My soul, my life force, my energy. Don't know what's gotten into me. I'm into you and the way you move. You feel me too. Just feel this groove 'cause I'm digging you and that smile too. My soul's feeling you. I could sing to you. It's all I could do. It's all I could do. Even if you don't care about the words I'm singing and this energy I'm sending, it just doesn't mean a thing. You're a work of art. You're a song. You're the apple of my eye. At least for the night, just consider not walking right on by. Bye. Just show me it's the right. Just show me it's right. Just show me. Just show me it's the right time. Just show me. Just show me it's the right time. Just show me it's the right time.
Così uli die sombranzelten meg et zu te saluda antes Dio hum niga Razzaus and malak estrezas durante in todo il memu a nogi distanza como kupugi palu zangiman malak guafi con una sugi airi preba tu la noci nai banderata gaigi pues atan fanni bandera kau esta pagua pumalalapa gilo tanu man libri sentamiti man ko badi
Samoru purita nota kantai matu nanyagi todu ilugat parai honra parai gloria abibais la sin parat parai honra parai gloria abibais la sin parat todo y tiempo y paz para hita dan gini langit na bendition Conchai peligro na fan sofuham Zeus protegis languahon Conchai peligro na fan sofuham Zeus protegis languahon
Osaina, Oaniti, Inumari, Amines Kuntan, Minale. Osaina, Oaniti, Inumari, Amines Kuntan, Minale.
Just make sure that it's worth the while and that it feels alright. All good vibes. It's alright, everything will be okay. When the sunrise, dark turns to light. Even when nothing is going your way. When the sun sets, don't get upset. It's up to you what you wanna do in this lonely summer night. Just make sure that it's worth the while and that it feels alright. All good vibes. So won't you fly? So won't you fly? So won't you fly over me, over me?
Hi, Sabrina.
Hi.
Hey, Jason.
Good morning.
Good morning.
Good morning, Joe, sir. And welcome
Dun,
back to
dun,
the
dun,
insanity.
Yep. Bum.
Ladies and gentlemen, bringing all the way back since the last time he was here, Mr. Mike Villagomez, the man who has stretched out many, many shirts.
Yes, that's right. Our buff factor on the show just went up
He's
20.
got the magic shirt on too.
It does, yeah.
JFK is in the house.
Good morning. It's 6:27 on this Wednesday, November 17, 2021. The end of the
Don't even
restriction.
say it.
I don't want to. I was going to say the end of
Well,
COVID
okay.
as we know it, but yeah.
Coming attractions.
Yeah.
We do have an interview that's coming up in just a short bit.
Yeah.
Our Nestor Lecanto had a fantastic sit down with Dr. Nathaniel Berg, of course, the chairman of the Physicians Advisory Group, and he said he is very, very confident that restrictions could be substantially lifted very, very soon.
Yeah.
And then shortly thereafter, last night, Adelup actually released a statement that they said they expect it to happen in the coming days. So
Yeah. Well, if anyone would know, I guess it would be Adelup, right? You would think.
since they sign off on it.
So yeah, and it was funny because this came just I want to say hours after Senator Frank Blas Jr. wrote a letter to acting Governor Josh Tenorio, basically saying, "Hey, call this thing off, man." And then we saw the announcement a few hours later. Coincidence? Probably. I mean, we've been hearing that. They were just itchy. As soon as Dr. Ann Pobutsky of Public Health came out and said, "Oh, once we get the cases down to 25 sustained, then we're out of the surge." And we did see a few days of 20s, and then we saw 40 yesterday. So I don't know where we're at, but I think people are just done with this crap. They're just done with it.
What are the restrictions again?
They're
The vax versus unvax.
yeah, so the restrictions right now currently in place is there's a gathering limit. Okay, first of all, if you're unvaccinated, you're not allowed to gather. It's illegal. But if you're vaccinated, you're part of the chosen. You can gather indoors at 10 is the limit, outdoors at 25. And then for covered establishments under public health guidelines, the unvaccinated are not allowed to dine in the restaurants. They're not allowed to go to the movie theaters. They're not allowed to work out at the gym. They're also not allowed to get massages. Oh, man. I feel for most especially the elderly who couldn't get the vaccine, right? 'Cause
Dance studios are considered gyms, right? They're places of recreation or exercise, I believe.
So yeah, the unvaccinated lives are like the movie Footloose. They can't dance, can't go to the dance studio.
We know how that movie ended.
And so yeah, it's whatever was under those covered establishments under the public health thing about. But honestly, they don't even check anymore, right? I mean, you guys go out to eat or you go somewhere, they don't even. No one's checking. No one cares. I mean, people quit listening a while ago, and I understand that, we want to lift these restrictions and we want to celebrate the holidays, but I just got to say, let's not forget who we lost during the surge. We lost a lot of our elderly. I mean,
What?
dozens of deaths.
Yeah.
I mean, it's a heavy price to pay. This is not a win for me.
Baby.
Yeah, there was two.
Yeah.
There was two last night.
Two,
The most,
two babies
the most,
died, 2 fatalities last night.
the most in one single day was what was it? Maybe about a month ago, a month and a half ago. There was 8 on one day,
Yeah. Yeah.
and we've had
That's why I don't think this
3
is like
infants as well, right?
I don't think this is like, hey, we did it, Guam, because we didn't do it. We didn't. Too many people died. The government didn't do enough to save people's lives. That's just what it is, guys.
Some of these people were vaccinated people too. So
Some of them
I
were
don't know.
vaccinated, but Bree, a lot of them were elderly,
Yes.
unvaccinated. We're not talking about crazy unvaccinated people who are like, oh, if you take the vaccine, you're going to grow a third eye. We're not talking about those people. Those people didn't get really sick. But the manamkul, who when you saw, they had underlying health conditions, so we don't even know if they were unable to take the vaccine. Right? So let's not forget that, because I feel like the administration is glossing. It's really sad. They're just glossing over these deaths. They want to get a medal, right? They want to give you guys Thanksgiving. They want to give you Christmas, which is fine. Of course, we want the holidays. But I'm just saying, let's kind of carry a little bit of that in our hearts, that we lost a lot of people along the way. And more definitely could have been done to save lives. Totally. We could have saved a lot of our Monomko's lives. They could be here with us to celebrate for these holidays had our leaders done more to stem the flow of this surge. Remember, they were pretty much hands off with the positive. They were, oh no, positive cases, it's going to spread. And so, yeah, I mean, I know you guys are tired. The COVID fatigue is real since last year. But that's what we're tracking, so to speak, is that they're going to lift everything. I don't know if it's going to be total freedom for the vaccinated and the unvaccinated. We don't know.
Have you guys been invited to any Thanksgiving celebrations yet?
No.
Or have you made any plans? Or?
I was thinking about what I'm going to do.
I was invited to one for my family, and that's even before yesterday's announcement came out. And my mom was asking me, she's like, "So what do you think about that?" I was like, "Nope, I don't mean to be rude. I mean, I know that is disrespectful to some degree and everything.
Maybe next year.
Yeah." And again, like I was saying with Mayor Jesse Alec when we had him on the president, of course, of the Mayor's Council, I was like, kind of my attitude is I was like, if we can scale back a little bit on Thanksgiving, I would rather put a little bit more oomph into Christmas.
Right. I mean,
even then, I'm not expecting Christmas to be like, oh, like, you know, deck the halls and here's 500 people, fa la 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 la. Check on my candy cane and my tinsel.
There's only gonna be
someone go and buy me Marvel movie passes.
Right. Yeah.
But I'm not expecting it to be that either. I mean, but you know, it could be a little bit better than it was last year.
Okay.
Yeah. So we'll see. But remember,
notice how I sang that traditional Christmas song and not the Mariah Carey one, because God knows we're gonna get like so much of that.
We had Dr. Ho on yesterday, and he was really concerned about the booster effort, and he said, "Hey, we need a campaign." And so, to me, I mean, I'm not living in fear or anything, but I just feel like we still have this window where a lot of people have not got the booster, and we're gonna go ahead and open everything up, and people are gonna gather. They're gonna have their Thanksgiving. They're gonna gun it. People are just tired of being. Well, they're just tired of being under this state of emergency. So they're going to gather. I'm pretty sure we're going to get cases, right? But I just hope that we don't end up right back where we started, because that's always the conversation we have when we get into these surges. The first thing we say is, did we open up too fast, right? I mean, that's what we're talking about with this last surge, was like, did we open up? And we had all the data there saying, oh, we had the military training, and then you saw the local transmission jump up, and then the household transmission, and then up to most recently, they were talking about workplace transmission. But, you know, public health, we don't really hear anything about their contact tracing, who the positives are anymore. In fact, we don't hear much of anything, and that was a big concern that Dr. Hoa had yesterday, Bree, was he said, why isn't there a campaign to tell more people to go out and get their booster shots? I guess we are the campaign, so go out and get your booster shot. Jay, where can they go get tested, vaccinated, and all that stuff?
Well, remember, if you want to go to the UOG Calvo Fieldhouse in Mingilao every day except Thursday and Sunday, so definitely today because it is Hump Day Wednesday, make your reservations at tinyurl.com/VAX Guam. You can also get it done up here in Dededo at the Dededo Community Health Center. Mondays, Wednesdays, Fridays up in Dededo. Tuesdays, Thursdays down in Alahan.
In Alahan. Yeah. Yep.
Finish the line.
Making my home in you.
Love that.
Yep.
They have to do a remix now with the proper pronunciation.
Yep. In Alahan.
Yeah. So if you want to get your boosters, again, 5 to 11-year-olds now approved. If you didn't know by now. And the hours have been slightly extended. Also, this Saturday, as Dr. Hoa Wen was saying, American Medical Center is holding a youth booster clinic over at the FD Phoenix Center, and that's going to be in the afternoon.
Saturday, right?
Saturday, yeah.
Okay. Thanks, Jay. 6:36.
Lots of opportunities to get it done, guys.
Yeah, we got the news coming up, but a story that I think a lot of people were talking about that we did yesterday, Bree, was this above-step recruitment. It's very similar to what we saw at the Department of Rev and Tax, where they gave that political hire, Julie Sinicolas Cruz, $11,000 raise just a month after she was hired, right? And she's a political hire. And actually, I went to Rev and Tax Friday, Bree, because I had to take care of some business, and I just want you guys to know, that the employees at Rev and Tax that I talked to, and there was a bunch of them, they were just very frustrated. And this really hit me in the heart, because They feel like they're not recognized, they're overlooked, that, you know, too much attention is being given to these political hires. One of them told me, Chris, we don't want an $11,000 raise, but we feel like we definitely deserve something. And so that has just really messed with the morale over at the Department of Rev and Tax, because they're absolutely right. You've got supervisors there who have been in DRT decades. They never get an $11,000 raise. They don't even make anywhere near what that political hire is making. And they're not idiots. That's the thing I love about our people, Bree. They're not idiots. I mean, you know, you work at Rev and Tax, you read the news, you're going to go in and you're going to feel like, damn, I'm not appreciated.
You see the one-page press releases
Yeah.
about breaking records and things like that.
Yeah, yeah. Yeah, so I feel for the employees.
And the supervisor of that particular branch still makes lower than what the
Yeah.
call center supervisor makes.
That's the thing. And so you have the income tax supervisor makes like $10,000-$11,000 less than some lady who just walked in and got hired for the election. It's insanity. It's an insult, really. It is. It's not awesome at all. And yeah, so we did this story on this above step recruitment. And to me, this story, it covers just a lot of different areas, because what you guys know, if you follow the show, one of our big concerns and frustrations is this administration does not like to engage the media. They just don't. The governor is very uncomfortable. I mean, you guys, I'm not even you just watch any press conference. She does not like to be asked questions. That's why we don't have press conferences. That's why the governor doesn't come on the link. You guys know there's a ban on the link. And so what this administration does is they're trying to be their own media. I mean, you see it. They have a Facebook. They do videos. They do more videos than us. I mean, serious. We're the media. They're paying people to produce videos to give you guys this positive image, because it's all image, right? And that's, to me, what really the center of this whole above-step hiring at the hospital was. I mean, they had a hearing for a board nominee, and she said, and it was in the story, we're going to play it, she said something like, you know, we really need a PIO because the employees, you know, no one wants to go to work at a hospital that's falling apart, right? No one wants to go to work at a place where the roof is leaking. No one wants to go to work where the elevator doesn't work. And it was just so ironic to me, because this board nominee was just reeling off all the problems that we have with the hospital, and then trying to say that's why we need a PIO to give us positive information so we can forget about the problems at the hospital. Sense or no sense? It makes no sense when we're hiring these DOD nurses,
Traveling nurses,
because we don't have enough nurses, but we're hiring PIOs when we could hire 2 nurses for the price of one above-step recruited PIO. And these PI, they don't even come on the link. The way I look at it, hey, PIOs, if you don't come on the link, they need to dock your pay $10,000 because your job way easier. And so what we have here is we don't have public information officers. That era is gone. What we have is positive information officers. And that's their job, is to provide positive spin. But I don't know if that's necessarily something that we should be paying for. I would rather pay for them to fix the elevator, or to fix the roof, or to hire nurses, hire respiratory therapists, hire all these crucial positions that we hear nonstop from the hospital. We don't have this, we don't have that, we got to bring in this, we don't have specialists, we don't have, yeah. But they got money to hire PIOs, and that's just not it. Bree and I were doing some digging last night, and there's a lot of above-step recruitment going on at the hospital. It's really nonsense. It's total nonsense. And I've been hearing about the political hiring going on in the hospital. But, I mean, what we discovered last night with these documents is that not only are they recruiting above step, and the thing that's messed up about the above step recruitment is for the regular classified workers, they don't get to apply for these positions, right? It's like they'll have a candidate in mind. Usually it's like, you know, someone political. And they slide right into that position, and all the other classified workers, they don't get to apply for it even if they're qualified.
You know, I got to say this because we're hearing that after the $11,000 raise got out, we're hearing that the call center supervisor no longer answers their phones. But, you know, shout out to all of the other ones that are answering the phones.
Yeah.
So kudos to you.
I mean, if you're above board and you got nothing to hide, then you're not going to have an issue showing up to work. I mean, and I'm not going to defend DRT here, but if this woman was worth it, then why didn't they come out and say that? Why didn't they come out and say, yeah, she got $11,000 raise, but she's got experience or this or this or this or this or this? But you can't really defend the indefensible. And that's what you're going to see with this above-step hiring that we're going to blow the lid off with the Guam Memorial Hospital. There was some above-step recruitment that they created, like this deputy assistant, deputy administrator of operations. So they're not creating needed positions. They're not creating those pediatric specialists that we need. They're not trying to recruit them. They're creating these political administrative positions and putting people in there. There was one above-step recruitment we saw where it went from like $115,000 to $134,000 a year. And the position was something like deputy assistant administrator, deputy of operations, something ridiculous like that. I mean, do you really need a deputy assistant deputy? You know what I mean? No, you don't. Yeah, and so obviously this is something we're going to ask Speaker Therese Terlahi about. She's coming on the show. She's the health oversight. We're also getting GDOE Superintendent John Fernandez. And we're continuing our week-long symposium on diabetes. But it's frustrating, Sabrina, it's frustrating to me knowing that, let's be real, no matter what the governor is telling the ratings agencies in New York City, they're not here. They don't see the reality. The reality that our people are hurt. Yeah, they're hurting. There's no jobs. I don't know how they're getting by. There's no PUA. We're not sitting pretty. People are scared about what's going to happen next year. And so when you have these people in power really perverting the system to recruit their friends and family or their paris or mullies or whatever at these crazy inflated salaries, I'm just insulted, because there's a lot of people out there who deserve opportunities, who deserve jobs, who aren't connected, who aren't all in, who don't get the time of day, who never get to apply for these positions, and that's just not right. It's Wednesday, November 17, 2021. Well, we're going to have a great show today, guys. Good morning. Brought to you by Pacific Points, Calvo Enterprises, IT&E, and Jack in the Box. Let's go ahead and get into our first look at the news, which is brought to you by Pacific Points with the very latest from the KUAM News team. Good morning, Sabrina Salas-Matanani.
Half a day, everybody. We could see the easing of restrictions in the coming days. We'll have more on that a little later. But first, the Joint Information Center reporting the island recorded 2 COVID-19 related fatalities. The 259th occurred at GMH on the 15th. The patient was a 66-year-old man. He was unvaccinated with underlying health conditions. He tested positive on October 9th. The 260th, according to the JIC, occurred at GMH on November 16th. The patient was an 80-year-old man and vaccinated again with underlying health conditions. He tested positive on November 3rd. 28 people now hospitalized for COVID. 4 patients are receiving ICU level of care, 1 on a ventilator. Out of the 28 hospitalizations, 18 vaccinated, 10 unvaccinated. Public Health reports 41 new cases of COVID-19 out of 1,222 tests performed on the 15th. 15 cases were identified through contact tracing. To date, there have been a total of 18,983 officially reported cases, 260 deaths, 1,807 cases are in isolation, and 16,916 have recovered. The CAR score, 3.3. As of November 15th, a total of 124,658 of Guam's eligible population, that is residents 5 years and older, is fully vaccinated. As for booster shots, the following have been administered: 13,677 of Pfizer, 6,883 of Moderna, and 173 of J&J. According to GDOE's daily COVID-19 report for Tuesday, there was only 1 new case of COVID, and it was an employee at Estumbo Elementary. GDOE's daily reports cover students who are enrolled in the face-to-face model of learning, who've attended classes during the time in which they confirmed positive with public health. Meanwhile, the CNMI reports 6 positive cases of COVID since October 28th. There have been 108 new cases, of which 75 were identified via contact tracing, 25 through community testing, 9 via travel testing. The total case count in the CNMI since March of last year is now 399. With more news now, here is Daniel Perez.
This news update is brought to you by Pacific Points. Do more, get more.
Half a day and good morning, everyone. I'm Daniel Perez with your headlines here on The Lake. U.S. President Joe Biden signed a $1.2 trillion infrastructure bill into law, the most expensive in history. A ceremony was held on the White House lawn to mark what was billed as an historic event, and Governor Leon Guerrero was in attendance, along with a group of fellow governors and congressional leaders.
To state the obvious, none of this would have happened without all of you. I really mean it. And also to the governors. Where are the governors? Governors, stand up. Come on, I want you to stand up. Red states, blue states, you all contacted me. You all said you were for this. You all stepped up.
Adelup issued a news release saying the White House invitation was received right before Governor Leon Guerrero was scheduled to return home from New York. She previously said she was going to Wall Street to meet with bond raters to encourage a boost to Guam's ratings. Adelup said the governor was among a select group of bipartisan leaders and key business representatives from across the country who were instrumental in the negotiations leading up to the bill's passage. She's quoted as saying, "It's a tremendous honor to represent Guam and the territories at this historic ceremony. Guam stands to receive $193 million to improve and modernize local infrastructure while developing new opportunities to address the climate crisis." Leon Guerrero added, quote, "The resources will go directly to addressing our infrastructure challenges, such as roads, bridges, village streets, and broadband. More importantly," she said, "this bill will provide quality jobs for our people." For Guam's News Network, I'm Nestor Lecanto.
Some $100 million will be used to repair Guam's crumbling roads. We reached out to Public Works for more detail. We hope to hear from them soon. As the holiday season draws near and family and company Christmas and New Year's gatherings are expected, what are the chances that restrictions on gatherings could be eased? Pretty good, says Dr. Nathaniel Berg, the chairman of the Governor's Physicians Advisory Group. He says they're encouraged by the latest data showing a great improvement in containing the most recent surge.
The light is clearly there at the end of the tunnel, and I think it won't be too long. And actually, I feel very confident that if we see this trend staying without numbers bouncing back up for some reason, that the restrictions will be loosened shortly. Of course, the governor has the final say in that, but she is inclined herself to start to release the restrictions soon.
Dr. Berg could not say how soon, but once the governor does make a decision, he says any changes to the current mandates will be gradual.
Social gatherings, the number will go up. It's extremely unlikely that it's going to go up to 1,000, so that some of the giant weddings will still maybe be put off for a while. But for sure, the social gatherings is likely to go up. No, I can say pretty confidently. That's one thing that the governor wants. And then looking at the changes for the restaurants as well, to be able to get people to feel back to normal. I think those are the two highlighted areas.
Dr. Berg continues to urge the island to get booster shots and for parents to get their children 5 years and older vaccinated. You can catch the full interview tomorrow on the link. Is an above-step recruitment for a hospital PIO above board? Is a PIO critical to hospital operations? These questions and more for a GMH board nominee. Here's more on this report.
The Guam Memorial Hospital now officially has a hospital marketing and communications director, aka a public information officer, and GMH's PIO is making $15,000 more than a starting PIO makes because of an above-step recruitment requested by hospital administrator Lillian Posadas. The hospital PIO also makes the same amount as the communications director for Adelup. GMH documents show that the new PIO requested a salary of $161,000, but Posadas instead hired her at pay grade Q7 for a salary of $75,600 a year, not including benefits. PIOs in Gov Guam usually start at pay grade Q, making $60,000. According to the documents, Posadas' justification for the above-step pay grade was based on, quote, exceptional qualifications. Meanwhile, Senator Joanne Brown questioning GMH's need for marketing.
To do an above-step increase for a marketing position, a hospital marketing and communications position, to begin with, I didn't know the hospital needed to have a marketing position. I mean, it's not like we're in the private sector and we're trying to market, our business.
Speaker Therese Terlahi raising the issue of the above-step recruitment at a confirmation hearing for GMH board nominee Sharon Davis. Davis telling senators she thinks the marketing position helps boost employee morale and the public's confidence at GMH, given the less than desirable conditions there.
Nobody wants to go to work at a place that is constantly being questioned and pounded down all the time, like you're not smart enough, you're not good enough, the roof is leaking, the elevator doesn't work, the Z-Wing needs to be demolished, our HVAC system is broken, the cafeteria is old, there's towels on the floor kind of a thing. I felt that it was really important that our community felt that it wasn't just bad news coming out of the hospital all the time.
GMH docs show Posada supported the above-step pay because, quote, Ms. Habib brings with her years of management and journalism experience. She has a master's degree in public policy and a bachelor's degree in journalism. Posadas calling her, quote, an invaluable asset to GMH. May Habib was originally hired at GMH in May as an unclassified management analyst 4, but she's now in a classified position as the marketing director. While Davis said marketing the image of GMH would boost staff morale, even calling the PIO critical, Senator Brown disagreed.
I think you're going to have employees that have been working there a number of years, probably didn't get an above step, and are performing critical work, are probably upset.
A review of GMH's staffing pattern shows a staff nurse makes $36,000 annually. An ER nurse starts at $41,000. A staff nurse 2 makes $43,000. A clinical nurse wound care supervisor makes $66,000 a year. And a respiratory therapist makes $39,000. For Guam's News Network, Chris Barnett reports.
A friendly reminder was sent to Administration Director Edward Byrne that the legislature still can't review real-time data from the government's financial system known as AS 400. Senator Jim Moylan says the budget law requires DOA to provide senators with read-only access to accounting and budget modules. He says the provision he successfully added to the bill is meant to provide greater transparency over GovGuam expenditures. In particular, he wants to know more about how federal assistance money is being spent.
The federal money is hers. Well, that's fine. So if you want to spend it, go right ahead. But we're going to look at your checkbook. And that's what I consider the AS 400 to do. We want to see the debits and we want to see the credits, right? And then we're going to watch per department where that spending is happening. So we can track on a daily basis, we can watch these finances and we can see a peak or a minus to see where things are going.
He says for months, the legislature has been asking to know more about the governor's plan to spend. He says at least they can track what she has spent through the AS 400 access. Senator Moylan sent a letter to DOA Director Byrne seeking an immediate response on what steps will be made to provide senators with access to the financial management system. That's it for now. We'll see you tonight for KOAM News Primetime.
This news update is brought to you by Pacific Points. Do more, get more.
A settlement was reached by members of the Consolidated Commission on Utilities and the Attorney General's office over an open government law violation. The AG alleged that the members committed the infraction in 2015 when they approved a salary increase for an interim GWA general manager during a closed-door executive session. The AG argued that such raises are required by law to be discussed and approved in an open session. 5 current and former members of the CCU signed off on the settlement and will be required to pay about $10,000. The proceeds will be committed by the AG's office to direct service providers such as the Lighthouse Recovery Center and the Oasis Empowerment Center. In regional news, there are major changes ahead in travel protocol for incoming travelers in the CNMI. If you're fully vaccinated and living with fully vaccinated people, you no longer need to quarantine. Tomas Manglotnya reports.
Because we don't want to quarantine you if we don't need to quarantine you. So we want to get to the information. If you can't provide it, we will help you. We'll make the contacts ourselves.
It's the sharpest pivot yet amid a rise in community cases and an aggressive vaccination and contact tracing effort. New guidelines for entering the NMI are expected to take effect on November 19. At a summit with 3 branches of government and private partners Tuesday morning, the COVID-19 task force announced that if you are fully vaccinated and those you are going to stay with are fully vaccinated, there is no quarantine. But you do have to be tested for COVID-19 on your 5th day. If your household is unvaccinated, you're subjected to a 5-day quarantine in a government facility, and if you are an unvaccinated traveler, you quarantine for 7 days. Those living with individuals ineligible to receive the vaccine will be addressed on a case-by-case basis.
Our focus with this change is about contact tracing, surveillance, and testing. We want to ramp those up, but we can't if we're doing everything else on the border with testing on arrival and testing on day, basically testing everything.
The governor is meeting with the Hotel Association of the NMI today to discuss how this impacts current specialized tourism programs.
Done everything we could to prevent and to keep CNMI safe. Again, we wouldn't be here if the collaboration and cooperation from each and every one.
The change comes as vaccines for children continue to roll out and the economic costs to run a quarantine facility mount for both the government and community. Having gone without COVID-19 longer than most, they're confident they're prepared to take this next step.
This is a step forward in terms of trying to support our businesses and being able to allow entry of those spenders, those patrons to our small businesses more quickly, more rapidly into the community instead of that 5-day delay.
Tomas Manglotnya for KUAM News.
GDOE will be hosting 2 online input sessions for high school faculty and staff and for parents and community stakeholders. The GDOE School Operations Committee will be presenting information on the return to 5 days of school for high school students on Wednesday, December 1st. The committee will be meeting with high school faculty and staff tomorrow afternoon. The parent community input session is scheduled for Monday, November 22nd at 6 p.m. The online sessions will be hosted via Zoom, where there is a maximum capacity of 500 participants. The sessions will also be live streamed on GDOE's Facebook page. Continuing our week-long campaign to promote diabetes awareness, in this segment we focus on prevention and care.
A healthier you, making diabetes history on Guam.
Presented in partnership with Calvo Select Care and Paradise Fitness Center.
Calvo Select Care Health Plan Administrator Frank Campillo sees the numbers daily, and when it comes to the statistics for Guam, they aren't good. That's why the insurance company has programs and partnerships to get Guam healthy.
Clearly and evident that Guam has a problem for diabetics. If we were a country, we would be number 10 in the world in regards to the incidence of diabetes. We're about 18.7% of our population that is between the ages of 20 to 79 are diabetics. And that correlates pretty much in the numbers that we see in our health plan. So we look at the numbers and then we look at things that can help our members.
Partnerships with island clinics and fitness centers are not only targeting prevention, but bringing the disease under control. One of those partnerships is with Paradise Fitness. General Manager Mike Scrow.
The first thing I always recommend to people is make sure you do your baseline. Get your baseline, do your labs, go see your primary physician and know what your foundation is. Once you know what your baseline is, it helps us professionals when you walk into BocaBox or Health Smart or Paradise to really help build a foundation for you to customize what I like to call your exercise prescription. At the end of the day, people don't know what type of daily dose of exercise to get. And I think it really comes down to just education and having the right people surrounding you to take that initial step. But I've seen people come in very sedentary, on insulin, reversing it to get off of insulin, or reversing pre-diabetic conditions, and just with simple lifestyle changes with just exercising 30 minutes a day.
But according to Scrow, when you tie in nutrition, that is a recipe for success. BocaBox's Jess Rosario and Payless Supermarket's dietitian, Rose Calvo.
There are a lot of different nutrition apps out there, and it can be tedious tracking food, but it's more educational to the person. We don't expect for someone to be tracking their food for the rest of their life, breakfast, lunch, and dinner, but just that as a starting point, once they see how much calories, especially if it's a lot of calories from carbs and the little vitamins and fiber that they're getting with everything they're eating, it makes a huge difference. And just that act of knowing what they're tracking, that's enough to just give them a little pause before they can, or just a pause so they can make some changes.
And one of the things that, at least for us, when people start coming in and they want to start eating healthier, right, and they have issues with glucose in the bloodstream and all of that, food is cultural, right? And so a lot of people are used to eating rice and meat and not a lot of veggies. So one of the first things we like to do is use our food as an educational tool. We want to show people that there's more to carbohydrates than just rice. You know, there's other sources out there. There's whole grain products, there's whole grain rice, whole grain bread, there's kombucha, there's quinoa, there's all these types of carbohydrates that could be good for you. And we always like to preach that, you know, food is not a problem. There's nothing bad about food, but what the problem is that we see is that the overconsumption of certain food products is the issue.
And then there's staying the course and not giving up. According to chairwoman of the Guam Diabetes Control Coalition, registered nurse Agnes White, if you fall down, get back up and get a squad that has your back.
I tell them, yes, you are going to fall off the wagon and don't expect it. It's just natural. So once they know that, I said, but please just get back on. That's what you have to do. The next day, okay, I mean, you picked out Thanksgiving Day and maybe through the weekend, but let's get back on course. So it helps to have some kind of support group. If you can form groups or communities that will say, hey, let's just get going and start again. Don't just come back on. That's what I encourage people.
Wednesday on The Link, we will be focusing on diabetes technology today.
A healthier you, making diabetes history on Guam.
Presented in partnership with Calno Select Care and Paradise Fitness Center.
All right, and of course, that special discussion about diabetes and technology treatment comes up at 9 o'clock today right here on The Link, so make sure to stand by for that. It's going to be really good stuff. All right, now let's take a look at what's happening around the island in Guam's native tongue. Here's Uncle King Conception with today's Chamorro News Update, sponsored by First
Buenos updates to get soon to be finut Chamorro ni KUAM News. Presenta ni Familian Mizo gi First Hawaiian Bank. Afirma si Presidente Joe Biden na di 1.2 trillion pesos na bio-infrastructure no ninalay. E seremony para ifinan man Biden na na bio sa masasedi gihat din gimena ni White House. Ibio sana 93 million pesos para project siya ginigizagwahan. Sigon ni press release gin ni Democratic Party of Guam kasi 100 million pesos guhin na sa lapi umanaw gatugi para mafamalik sa lanta 11 million pesos para transportasyon publiko na sistema sa 25 million pesos para wana mas adelanto distribution broadband internet. Pag-usiyan na may sa pumaresibi kasi 110 million pesos. Makumbira magahaga Leon Guerrero para attend the ceremony finit man Biden. Mas asunto, sisiga zi booster clinic siya makontinua gunigi islata. Gidedo Senior Citizen Center gi martes kadumi man matugatugi para maakumpli mas pernitehi para siya kontra coronavirus. Persona no tato dedo si Francisco Ong sa uno ni San Miguel naman matugwihi sa explica na madulog ni booster para upertain may sagwi e familia niya ineta za ni neto siya zan todi manggayigi rizanya. Esa 13,451 na residente ni isla sa man madulog ni Pfizer na booster. Zan 6,699 sa man madulog ni Minatres na amon Moderna. Man mamayla na booster sa Paraguato gi Jim gita hagat di stilas 9 gi egan stilas 12 gitalo ani. Yuto mo na sunto gifinut sa moro para pago na Merkules gini KUAM News. Mananaw ginotisya Direktor ng Departamento ng Administrasyon si Ed Byrne ni Legislatura para masanganin na destipago ti sinya mara bisita i real-time data gini System and Financial o gobernamentong gohan na mafananan AS400. Ilinga si Senador Jim Moylan na ilagi budget sa demanda na DOA humanai todi Senador siya na fanhalong gihina sistema para mali accounting and budget i gobernamento na informasyon. Ilinga neste na probisyon na nasano gibiyo niya sa puro mas ngulo hinanaw niya ikas ng gobernamentong gohan. Especialmente sa putamano magasta dis lapi federal para inasisten ni Tautauta. Ilingan na pud meses na tempo mamamaisin legislatura mas informasyon pud planunya gobyerno tay mano para gasta estisiana sa lapi. Masasangan na kumo mamatetso aduna sisteman AS 400 sina masesa natan hafa magagasta. Ananago si moilang kata si Bern na fafay sa no respondo in sigidas. Nitamano por man na siguro na sina sa nadot siha o manasabi financial management na sistema. Para Guam News Network, Golsikin Conception. Yasuto ifinut sa moro sa presenta sa ninafatto ni Familiang Mizo gi First Hawaiian Bank.
Say hello to the First Hawaiian Bank mobile app. Want a better look at your spending? With Money Map, you can automatically create budgets and manage where your money is going. Know when you have a green light or when it's time to slow down. Maybe cook more meals at home this week. Set your goals, track your progress, and find your way to exactly where you want to be. With Money Map from the First Hawaiian Bank mobile app. It all starts with yes.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
Marianas Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutter, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Marianas Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Marianas Irrigation and Landscape Superstore.
Do you feel like you're missing out on something? Make life more rewarding with Pacific Points. Earn and redeem points for bill rebates and free load at IT&E, discounts on fuel at Shell, vouchers at Foodies, and United Mileage Plus miles. You can even pay with Pacific Points at IT&E, Shell, and Foodies. Pacific Points. Do more, get more.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage. With generations of Filipinos calling Guam home, KUAM presents a monthly look at the capital city, featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by KFC.
We all know that a healthy lifestyle is important to prevent chronic diseases and long-term illnesses and boost mental health. It's difficult to determine exactly which healthy habits are worth investing in to live longer and healthier lives. But FHP is here to help. Tune into The Link every Tuesday for FHP Hafa Health Tips, brought to you by Take Care. Helpful advice about healthy lifestyle choices that will have a big difference in your health from the medical experts at FHP Clinic. FHP Hafa Health Tips on The Link every Tuesday is brought to you by Take Care.
Uno Mixed. We're mixing it up on the last Thursday of every month with a look at lifestyle, entertainment, food, and so much more on the stations, networks, and digital platforms of KUAM Communications. Uno Mixed is presented to you by Docomo Pacific, Better Together, and Pepsi. That's what I like.
1 in 6 people on Guam are affected by diabetes. The terrible impact of the disease on the island has only been amplified by the COVID-19 pandemic, as many of those hospitalized and those we've lost had pre-existing underlying conditions like diabetes. As November is Diabetes Awareness Month, KUAM News has partnered with AI Health to raise awareness for this disease that affects so many of us and to showcase a number of ways to prevent, treat, and care for those with diabetes. Join us for AI Health's A Healthier You, Making Diabetes History History on Guam, a multi-platform campaign on KUAM communications, including a 6-part series on KUM News Primetime and Weekend Edition, and our digital media platforms kicking off on World Diabetes Day, Sunday, November 14th. Daily interviews with expert panelists on the link beginning November 15th, and a special interactive town hall meeting on the link with experts from AI Health, with more information on their diabetes validation study and a new level of precision care that aims to create a healthier Guam. A healthier you, making diabetes history on Guam. A look at how diet, exercise, and technological advances in disease monitoring and medical care can have a positive impact on our community.
The Healthier You series on KUAM News is presented in partnership with Calvo Select Care and Paradise Fitness Center. Learn about people and organizations making a difference in our community on the greater good every Wednesday during the link. Building awareness, promoting events, generating change. Find inspiration to seek out the greater good every Wednesday. Listen, watch, stream. Miss the link? Miss a lot. Presented by Jay Goodman, a happiness company, and Guam Windward Memorial. Celebrate life.
Back to the link. We are continuing our program here, and as you saw last night, we actually shared on Facebook. Our own Nestor Lecanto had a very, very lengthy interview with Dr. Nathaniel Berg, the chairman of the Physicians Advisory Group, during which they touched on testing policies, the possible lifting of restrictions, and if the doctor himself feels that enough has been done, and if he's been satisfied with what has been done to contain COVID in our community. Here is that full interview.
All right, so Doc, from your vantage point as the chair of the governor's physicians board, where are we at in terms of containing this latest surge? And is there a light at the end of the tunnel for easing some restrictions?
Yeah, I think actually, Nestor, every day when we have our morning meetings with the governor, sort of you can see this looks that have gone from great concern to lots of smiles around as the data comes out and shows that our CAR score is now better than it was before Delta ever started. It's down below 4 today. The CAR score is 3.9. That the number of people in the ICU continues to slowly go down, a little bit up and down, but the trend is clearly better and better. In fact, at GRMC, if I recall from today and yesterday, there are no ICU COVID patients, which is, I mean, something we should be celebrating. The number of patients altogether in the hospital is lower. We do still have deaths, but now we're finding it's more, we're left with these small number of people who are still not vaccinated. We're way above 90%. And the ICU, as we've experienced before, is almost all unvaccinated. But I think people have been listening, and we're still doing quite a bit, even though they're latecomers. We're happy to see people seeing the benefits of getting vaccinated. But to answer your question directly, the light is clearly there at the end of the tunnel. And I think it won't be too long. And actually, I feel very confident that if we see this trend staying without numbers bouncing back up for some reason, that the restrictions will be loosened shortly. Of course, the governor has the final say in that, but she is inclined herself to start to release the restrictions soon.
Yeah. When you say soon, obviously we've got Thanksgiving coming up this month, and then Christmas and New Year's, the holidays. A lot of people are looking forward to getting together, with families. Will there be an easing of restrictions before that time, and what will it look like?
I would say, so of course, because the governor hasn't given her final approval of exactly how we're going to lift it, I would say people can expect two things. One is that it will be gradual, right? We don't want to, we're fast on Guam. We can switch our on and off school, on and off, or restrictions on the number of people we can go out with pretty quickly. We don't like it. And so we'd rather sort of gradually increase it,
do it for a few weeks, and then if that works good, further release restrictions. For example, you can expect that social gatherings, the number will go up. It's extremely unlikely that it's going to go up to 1,000, so that some of the giant weddings will still maybe be put off for a while. But for sure, the social gatherings is likely to go up. No, I can say pretty confidently. That's one thing that the governor wants, is to increase the amount of social gathering, because we're a social group on Guam, right? And then looking at the changes for the restaurants as well, to be able to get people to feel back to normal. I think those are the two highlighted areas, but lots of other things. The one thing, though, Nestor would emphasize is that we don't want to take, if you will, 3 steps forwards and then take 2 steps backwards, so that the mandates that do stay in place, we really need people to cooperate so that we don't have a bump. And also, myself and my colleagues are really hoping that people sort of learn that the new definition of fully vaccinated means that you got your you got your 3rd dose, your booster, 6 months after your last dose. I don't know any physician who hasn't done that. I think there are a couple maybe, but in my circle that I know of people, everybody wanted to get their booster because after the 2 doses, we know that after 6 months, we were so good at getting vaccinated on Guam that we had a large number of people after 6 months who needed to get the booster. Otherwise, they were going to get sick. They weren't going to get very sick, but the effect was wearing off. So I got my booster. Everyone else has gotten their booster because we were early endorsers, if you will, but we knew that our immunity was waning a little bit, such that we could get sick and be in the hospital, even if only a few days, but we could probably avoid that. Statistically, you could almost completely avoid it if you get your booster. It's not 100%, but nearly everybody who gets their 3rd or booster dose has been able to avoid being admitted to the hospital. So it's a combination of loosening restrictions while telling everybody, hey, when were you vaccinated? Add 6 months of that and come in and get vaccinated. Still free, still widely available at multiple places. On top of that is to get the kids vaccinated. If we can get the kids vaccinated, kids, thank God, they're not likely to die. They still can get sick. We have had a number of people in the hospital, number of kids in the hospital. The odds of that are low, but at least we feel that they're less likely to be more active spreaders. They can get it passively, but if they get very sick, they're probably spreading it. So that will, I think, give parents reassurance. It gives teachers reassurance, administrators, and helps with some of the vulnerable people in their family that even if you're vaccinated, we know that they still could get sick, and those who have not gotten their 3rd dose, or even those with comorbid conditions, we don't want them to get exposed to COVID at all. So it would allow kids to feel safer and not worry, and have their parents not worry that they could be with grandma or grandpa, that the Manumco can enjoy being around kids again.
Yeah. And how important is the booster and the vaccinations for children 5 to 11 going to be in easing the restrictions? Is this really where the rubber meets the road, as they say?
Probably not, Nestor. I think what it really means is we just sort of, meaning as long as we're seeing a clear path towards not having our healthcare system at risk on Guam, we've been doing great. Even with Delta, we've done okay. The real issue is we don't have a town next door to send people to if the hospitals get full. So as long as the hospital system is not in jeopardy, as long as what we've now sort of commonly called our fragile healthcare system of Guam, it's good, but it's fragile. If we get too many people in the hospital, that leaves others waiting too long. That was our big concern. I mean, bravo to the entire community in terms of, coming together and making sure that didn't happen. That's our main guide. Is if the hospitals are doing okay, we can start to reduce the restrictions. It's more of, it's not dependent upon people coming to get their 3rd doses. It's not dependent upon all the kids getting vaccinated, but we're saying as a community, we have to do that. It's sort of a commitment that we're hoping that we as a community, as we did early on, all got vaccinated, or 90% of us so far, that we make that commitment to say at 6 months, come and get vaccinated, get your 3rd dose. And that way you won't ever get admitted to the hospital. a promise, no, but a huge decrease in the likelihood you'll get admitted to the hospital if you get your third dose. And your doctors, we all trust these vaccines. You have 3 choices, and we all believe in the effect because we see it firsthand. So I think that if you haven't gotten it, it's time. The safetiness has been out long enough. You can feel safe getting your vaccine. If you've had 2, come and get your third, or if you did Johnson & Johnson, come and get your second, and take your children in to get vaccinated. It'll make you feel more comfortable. It'll be a safer environment around everywhere they go, including hopefully with Manumco and older kids.
Are you happy so far with the rate at which the boosters and the child vaccines are being taken up?
Yes and no. I'd say we're doing okay relative to other communities in terms of how fast. And I think that public health made the first order in the nation for the childhood vaccines. So we're going as fast as we can. I think there's still a little bit of difficulty in terms of getting that vaccine readily available for the kids everywhere. We know that if parents are working and kids are in schools, we need to make it truly available every place. We will. And also it came on so quickly that even though we did plan and go as fast as we could in terms of planning, we want to make it even easier for parents to get their vaccines. And then again, with the booster, again, a lot of people working all day, every day, so they haven't made time. So actually, after this conference call, I have another meeting with some public health officials to see if we can work with those who can only come in the evening or perhaps on Saturdays, making it easy for them as well. We don't want people to lose income for it. We don't want people to have to take off work. So we'll, as a community of providers, try to find a way to make it so it's easy. I would like to have 90% of people who got vaccinated, 90% of us got vaccinated. I'd like every one of them to get their third dose. So yeah, I'm always looking to get that last person in the circle of safety. So I'm happy. It's been pretty good, but we'll work hard as a community of providers. And we ask the community to try to find a way to come in and get your third dose, especially for those who have significant other illnesses, what we call comorbid conditions. If you're diabetic, if you have high blood pressure, if you have other conditions that require you to be on chronic medications, it's likely that there's a high likelihood that this will be a big benefit to you, the third dose, that is.
Yeah, there seems to be a certain small percentage that do not want to be vaccinated and will not be vaccinated even at this point in the game. What do you say to them?
Well, I would say, I think it's important for people. I see sometimes on blogs and comments that people think that we are discriminating against the not unvaccinated and purposely setting them aside as a second-class citizens and like. And I think nothing could be further from the truth for the leadership in Guam that I've seen on both the healthcare and administrative side. We care about the unvaccinated, and all you got to do is go to the hospital and see how much care is there and is provided. Nobody discriminates against people who smoke. We advise them strongly not to do so. We limit where they can smoke so that to reduce the potential harm to others. But the reality is we don't want people to smoke. I don't want people to get lung cancer. But it doesn't mean that I care any less about those people. And whether it's my own relatives, shoot, I have a brother who won't quit smoking. Of course, I still care about him just as much as everyone else. And the same is true for the unvaccinated. I advise people to get vaccinated. I'm happy to talk to them about why I think it's important. But if they don't want to get vaccinated, they do need to understand that we may place some restrictions, just like we do on non-smokers, because we don't want to overwhelm our hospital system. We want to keep people from getting COVID who are unvaccinated. But it's not because we don't care about them. It's actually the opposite. We care just as, I shouldn't say the opposite, we care just as much about those people. So it's not a divide and discriminate kind of thing. It's saying we ask you to come together and help the community. I do feel there's a certain responsibility to quit smoking. And I do feel there's a certain responsibility to get vaccinated, but it's not going to change how we feel about those people. I just say the science is pretty darn clear that it will reduce your risk of becoming seriously ill versus the potential risk. And no one has said that any vaccine is not without risk. All of them are. I get a flu vaccine every year, and I've actually gotten sick when I got a flu vaccine. But I come back the next year and say, I hope that doesn't happen again. And I get the flu vaccine anyway because it's worth it to avoid getting seriously ill. I got a minor illness when I got the vaccine, but that's what we're saying is what would happen here. Your risks are very low. The benefit is huge in that there's an extremely high likelihood it will prevent you from dying from COVID. To me, it seems rather clear, but I understand that that's only the advice I can give as a doctor. It's not my choice to tell a patient what to do. It's my obligation to advise patients what to do.
Yeah. A few weeks ago, we had this new development with regard to DOAs, and then the CDC apparently came in. Have you heard from them, and have they had a chance to look into that, and what might have been the cause of it?
Well, we do have some experts here, and we do seem to have I don't think we're having it now, but we seem to have a much higher rate of dead on arrivals due to COVID than other places. So it was a good idea to have the CDC come out. I can tell you that, no, first of all, they have not come and given us their data. So I suppose I should wait until, because I don't actually have any data. It's not a secret. Those guys work kind of slowly, right? They're looking at mathematical projections and trying to figure out why these people came in. But a lot of them, at least I should say a fair number, their relatives said that the person was getting very sick at home, and some even were scared to come to the hospital because they thought there was COVID at the hospital, when in fact they actually had COVID, but they went undiagnosed. So they had COVID at home, and then they died at home with COVID, but wouldn't come to the hospital because they were scared they were going to get COVID, which is a sad set of circumstances. We've been trying to help people understand that around this time, you got to come in if you feel sick at all, little short of breath, cough, congestion, come and get tested. I might add, Nestor, that that's one of the important things as we move towards opening things up. Right now, we're at less than 6% or around 6% positivity rate, meaning that if 100 people come in, on average, 6 of them are showing up as positive. That's like twice as good as we were before. We were at 13, 14%. Now we're at twice as good, or cut it in half, I should say. So keeping up testing on a frequent basis, particularly if you've been exposed to anybody, particularly if you start to feel ill and are in an environment where you potentially expose others. What's important about that is that we have treatments now, so that if you're positive, we can get treated right away. And that is so critical. We've had, I think, close to 800 people now who got treated with, I think, 2 ended up getting sick. The rest got better very quickly. 2 ended up with hospitalizations, but that's a great rate out of almost 800 people only who all had symptoms, and or virtually all, and only 2 ended up in the hospital. So we're telling people, I'll tell you right now, if I got COVID and I was even the slightest bit, well, I would do it because I'm in a healthcare environment. But if I wasn't and I got COVID and had the slightest symptoms, I would get treatment right away. So as to avoid, you get better faster, you avoid hospitalizations, and you're less likely to spread it. At least that's what we think. The main thing is to get vaccinated, but if you're not yet on your 3rd dose and you get COVID, this is the way to avoid getting hospitalized.
All right, Doc, before we let you go, obviously we're all waiting to hear from the governor on when she might make that decision to kind of ease restrictions, especially heading into the holiday season. Any final words on that?
Yeah, and I'd say is to please follow the governor's directions very closely, meaning if she says it's 50, don't make it 51. Just make it 50. Stick with the mandate so that we could all move forward together as an island, while remembering to get tested if you feel sick. Please get your 3rd dose and have your loved ones, particularly those who have other medical conditions, get tested as well. And if you haven't been vaccinated, to make a real sincere rethink of whether that's wise in what we've seen through the Delta, which is that only the unvaccinated have ended up in the intensive care unit. And talk about it with your doctor, knowing that with perhaps rare exceptions, there aren't healthcare workers who are judging you for your decision. We just want to give you the best advice we can, and we're available to help you make what is, we think, the best decision, which is to get vaccinated. And don't forget to get your kids vaccinated as soon as you can. Thank you, Nestor.
All right, Dr. Nate Berg, chairman of the the governor's Physicians Advisory Group. Thanks for joining us. Appreciate your time.
Thank you.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
Mariana's Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutters, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Mariana's Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Mariana's Irrigation and Landscape Superstore.
Do you feel like you're missing out on something? Make life more rewarding with Pacific Points. Earn and redeem points for bill rebates and free load at IT&E, discounts on fuel at Shell, vouchers at Foodies, and United Mileage Plus miles. You can even pay with Pacific Points at IT&E, Shell, and Foodies. Pacific Points. Do more, get more.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage. With generations of Filipinos calling Guam home, KUAM presents a monthly look at the capital city, featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by KFC.
Let's get merry during the most wonderful time of the year by making spirits bright. KUAM Communications and Coast 360 want to highlight your decorations and lights by flooding the social media pages of KUAM with your videos and photos. Finish your holiday setup, snap a few shots or video of your delightful display, and send it to us through social media or email them to promotions@KUAM.com. Check out our posts every Friday or tune in to KUAM News Weekend Edition for a special montage of the submissions certain to be making spirits bright with every broadcast. Warmest holiday wishes from KUAM Communications and Coast 360 Federal Credit Union. Together, we thrive.
This holiday season, we're once again bringing together the island's largest array of local vendors for a special innovative way for you to shop, broadcast, and go digital with Team KUAM. Join us on Sunday, November 28th for the annual Christmas Pops Virtual Holiday Market at 12 noon on KUAM TV8 and the KUAM News Facebook page, plus additional show times through December 11th. We'll also be featuring vendors daily with posts with QR codes and links on our social media pages beginning Monday, November 29th, and hosting an exclusive Christmas Pops website for your one-stop shopping. It's a safe and convenient way for you to shop local this holiday season. To reserve your spot, email promotions@KUAM.com today. Virtual space is limited.
Presented by UOG School of Business and Public Administration, JA Guam, inspiring youth, and the Guam Visitors Bureau, making Guam a better place to live, work, and visit.
This year, Giving Tuesday falls on November 30th.
And though our community is still facing some of the most challenging of times, there's no better time
to volunteer, donate, spread awareness, and do whatever you can to help those in need.
Let's continue to build a wave of generosity
that creates a ripple effect for all in our community.
Throughout the month of November, Team KUAM Care Force will be showcasing some of our favorite charities.
To inform, inspire, and introduce you to the wonderful things these groups are doing for our community.
We're also calling on you to donate to our food pantry and toy drive to benefit the Salvation Army at our KUAM studios.
Any weekday between 10 a.m. and 2 p.m. starting on November 1st.
Or stop by our second annual donation drive-thru event on November 30th.
You can also visit our studios to sign our Kindness for Caregivers wall to show our healthcare workers our appreciation.
So be a giver and join the KUAM Care Force this year in making a difference this Giving Tuesday.
Giving Tuesday 2021 is presented in partnership with our community partner, APL. Better Ways.
Join KUAM every Wednesday on Primetime for Inside Business. It's our new weekly segment featuring the struggle of Guam's businesses during this global pandemic. We'll hear from industry leaders about the difficult decisions they were forced to make to implement cutoffs, layoffs, and shorten hours just to survive. It's the other side effect of COVID, the island's economic crisis. We'll also feature new businesses that managed to open and thrive during these challenging times. It's Inside Business every Wednesday on KUAM News Primetime.
Your Above Step morning show. That's us. What? We're not. I think we're above step. I think we're top tier. It's the link. Good morning, Jason.
It's your. Are we classified or unclassified?
We're definitely classified. 7:38 Wednesday, November 17th, 2021. Good morning. Let's go ahead and get in with the Speaker of the Guam Legislature, Speaker Therese Terlahi, joining us for her every other Wednesday check-in on the link. Good morning, Madam Speaker.
Good morning, Chris and Sabrina and Jason and all of KUAM, and a good morning, Guam.
Right on. Good morning. So last night, Sabrina and I were doing some digging because we did this story that, and I know that you had kind of mentioned this during the nomination confirmation hearing for the GMH board nominee, Sharon Davis. Because it had been going around, right? There was, and I think documents about this were going around since a couple months ago, but more recently there was that above step recruitment for the hospital's public positive information officer is what I'm calling it. And so the line of questioning, I mean, from you started it was kind of like, hey, is this critical? Does it get in the way of hiring, critical positions? We all hear all day about the shortages in staff. I mean, we all know that we're using these travel nurses. And then it kind of like went in and they passed the mic to your colleagues, and Senator Joanne Brown kind of went in further. So anyway, last night we were doing some digging on this above step recruitment, and come to find out that there's been a lot of above step recruitment at the hospital. And just at a cursory review of it, Madam Speaker, there are a couple instances where, I mean, just looking at it, like there was one brief for.
Let's see, we have in February a data processing supervisor, step 1 salary $45,000, step 10 $62,000. April, above step recruitment petition for food and beverage manager, normally starting at a salary of $49,000, but they want to bring this person on for $68,000. Also in April, a management analyst 4, normally starting at step 1, $49,000, to step 10, $68,000. May, above step recruitment for a program coordinator 4 for capital improvement projects, salary $61,000. June, above step recruitment for a program coordinator 3, normally starting at $45,000, petition for $61,000. July, my goodness, another position. August, management analyst 4, $49,000 to $68,000. October, a hospital chef supervisor,
What?
37,000.
Wait, what? Hospital what?
Hospital chef supervisor.
Hospital chef
Yes,
supervisor. So we hired a
step 1, 37,000. Step 10, 50,000. Management analyst 3. This one was in October. Step 10, 55,958. Petition for creation of positions. This was October 13th. Deputy Assistant Administrator of Operations for $124,913. Petition for
Where's that at? Where's that at?
These are all GMH.
Yeah.
These are all GMH. Another one, October 13th. Assistant Administrator of Operations.
So
yeah, that's the deputy assistant, and then there's an assistant administrator of operations, but the same thing. This one's for $134,000.
yeah, what's the step increase on that one, Bree?
For the for the assistant administrator of operations, it's 76,000 to 134,000.
Whoa!
And then the deputy assistant administrator of operations. So this is the deputy assistant to the
So
assistant.
I think they created that position, and then there was above step. But anyway,
Yeah,
I mean,
so that's 70,000 to 124,000. So that's the deputy assistant to the assistant.
deputy assistant to the that's like a government. That's a joke. You can't be serious. There's no deputy assistant to the assistant.
There was some like medical coders.
Right. Yeah, but with the medical coders, like I looked it up, and it's not like a highly technical field. And the above step recruitment that they got for these medical coders 1 and 2, it was like 10 grand above what they make nationally.
Yeah. Hi, speaker.
Hi, speaker.
Good morning.
Yeah. Good
Yes,
morning.
okay.
Wow. Yeah.
Yeah, I want to thank KUAM for doing the hard work of really going through hiring. I think you've been doing this very consistently and looking at the details of hiring. And of course, creation of new positions is usually very rare, right? And absolutely the above step recruitment is also, I thought, supposed to be rare, where these positions are extremely hard to fill. I think that the danger in this type of thing is, of course, diverting funds from other critical uses, right? And if we are willing to pay in other agencies for these positions at a certain rate, you know, there should be some kind of justification as to why in this particular agency you can't pay that same rate and why you have to pay someone's you know, above step. And the other concern, I think, with this type of hiring is, of course, the competitiveness. We are supposed to have a merit system that is competitive based, right? Merit based and competitive based, so that everyone has a fair shake at these jobs or promotions if they are that, right? And that is really my concern. You know, I am concerned that we are catering the positions maybe to particular people as opposed to just putting out what your absolute necessity is and letting everybody compete based on your need, as opposed to, I like this person and let's create my job around this one person. That's not supposed to happen at all in a merit system, right? And then, of course, when we're talking in particular about GMH, it's always been our concern that we have critical needs at GMH that must be prioritized. And if we cannot fill nursing positions, you know, nursing positions determine how many beds we can fill over there. And we've been paying exorbitant amounts for traveling nurses, and we still have gaps in nursing. And I always believe those are critical. The hiring of specialists is, of course, critical. And there's been, you know, so much talk about, you know, why is GMH not hiring specialists? Well, they have all the authority to hire specialists and to set salaries for medical professionals as needed. In other words, if specialists are hard to recruit, we want to put money into that and recruit them, right? And past legislatures have found that to be an acceptable policy because of the hard to recruit specialists. But to recruit administrators, this is not even the hospital administrator. We're talking about, you know, other level administrators. Yeah, I share your concern. I mean, I am concerned that those are the things we are sidestepping. So we've had several oversights regarding GMH hiring practices. And I concentrated back then on the hiring of nurses and the hiring of medical professionals, because even the medical professionals on Guam complain about, they will complain privately, but they've never come to the public hearings, most of them to say publicly. And that's an issue, about their complaints regarding the hiring of medical professionals at GMH and how they're not, what's being prioritized over there. But I think we all share the same concern that if we want to prioritize medical professionals, we want to prioritize capital improvement projects that we have watched for years, over 5 years now. We've been trying to put money towards the elevators, the roofs, the HVAC, and the EHR. Get those systems in place. And I have to say that almost every single one of them is still pending. Maybe the elevators are complete, or at a certain point they were completed, but still the rest of it is still pending. And so those are very concerning. I think we've penciled in an oversight hearing. We're trying to work around the session we have coming up. We have a 2-week session coming up. This is for November, to take care of. It looks like we're going to have to take care of some of the bills we put on hold in October, whatever, so this session will run from November through December, and for 2 weeks. And we have a lot of bills that may potentially be considered. But anyways, what I'm saying is, so we're trying to schedule an oversight hearing around that, that doesn't interfere with our session, so that we can complete our session and all the bills that we might have on our agenda. But this oversight hearing in particular is going to focus on hiring practices, vacancies and hiring at Guam Behavioral Health, and vacancies and hiring at GMH. I think these two things, I think this is actually going on across the government right now, unfortunately. And I'm hoping that all the other senators will also, try to get a handle on this above step recruitment, hiring, this creation of new positions. When we went through the budget hearing, sometimes they would tell us they needed to create new positions. For example, I remember Chamorro Lantras talking about the creation of a couple new positions, but they were severely understaffed, and I think that they could use these positions. But what we really want to find out is, they tell us they're funding this above step recruitment through vacancies, right? So they don't fill a vacancy, they take that money, they use it to fund the above step recruitment. Well, that's why I think we should look at them together. What are the vacancies that they have decided not to fill? And why did they decide that? And then of course, why did they feel the need to hire above what was being advertised, right, at the time?
Speaker, I want to get in, and just because I know Sabrina read off a lot of these above step recruitments, but I want to actually share with you and the audience just how many steps we're talking about, right?
I think 10 is the highest you can recruit for, right? You can't go like step 11 or whatever.
Yeah. So for example, this petition for creation of a position, and this is October 13th, about a month ago. The hospital deputy assistant administrator of operations is a position that they were trying to create, and the pay jump is from step 1 to step 18. So we're talking about a position where they are supposed to enter at $70,873 annually, and they are being jumped all the way to step 18, which is $124,913 a year. So that is a $54,000 increase in pay. These medical records coder 1 and 2, the step 1, $31,000 to step 18, $54,000. We have the petition for amendment of position, which is they amended the assistant administrator administrative services to assistant administrator of operations. And the step here, step 1, $76,188 to step 18, $134,000. Management analyst 2, step 1, $40,000 to step 10, $56,000. And that's a management analyst 2. That I don't know what they even do. Hospital chef supervisor. From step 1, $37,000 to step 10, $51,000 a year.
Yeah, as I said, I don't know the reasons. They have not given us the reasons or the justifications for these above step recruitments. Traditionally, these are because they have tried to fill them at the regular rates and they've been unsuccessful. So that's one of the reasons why we've scheduled the public hearing. I think it's going to be set. We have the 13th, 14th, and 15th at 5 p.m. So it's going to be on one of those days that we if they don't justify it before then, of course, we are asking that we get justification for those. But we've seen this, of course, we've allowed this for very hard to fill positions and very critical ones. And like I said, prior legislatures have absolutely given the discretion to GMH to hire, to adjust salaries for medical professionals because we want to bring them in. They are our priority. And so I want to make sure we're not taking away from money that should be dedicated towards medical professionals, including nurses. And if nurses are making less than some of those positions that you've read out, I think that's also another concern, right? It's like, how do we say in one breath, we're trying to prioritize the recruitment of nurses, specialists, and other medical professionals, and then we hire above step for other less critical positions. And I know that GMH, is competing with a very short list of people around Guam who can fill maybe some of those positions, but I think that they should justify it. Why did they decide step 18 as opposed to
step 2,
any other step, right?
Or step 3 maybe.
Yeah. So they need to be able to justify that. Or is it especially if the job can be handled by someone in the current job description at the current pay, right? Or at the regular pay without the above step recruitment. They need to show that they were completely unable to fill those positions. And how long did they advertise it, right? And what was their effort in that? Like it just doesn't remind me of the medical professionals, the engineers that we have a very hard time in the government recruiting, to be on staff full time, that type of thing. Management positions, coders might be a little unique. And I know that they're competing with, of course, GRMC, they're competing with the private clinics. So if it's really necessary to compete with those and bring them over to GMH, we should hear about it, right? And we will hear about it. But some of the positions, the way you've described them, they're very general and they seem like mid-level management, and we should hear more justifications.
Yeah, I mean, look at the assistant deputy, whatever it is, assistant.
Assistant to the deputy.
Right.
Yeah.
So that's from $70,000 to $134,000. That's $54,000. When we look at the staffing pattern, a staff nurse one makes about $36,000 to $40,000. So you could put a nurse in that position.
Yeah.
And it would be covered by the amount of that. I mean, to me,
we've seen this over the years. GMH has increased its administration, I think, for sure, right? Their administrative level. We've seen increases there. They justify one of them based on, they're pursuing accreditation now. So they want one position to be dedicated towards pursuing accreditation, that type of thing. One position for this EHR implementation. And some of the other things that were highlighted in the oversight hearings. But again, right, we're still waiting for the implementation of the EHR. It's kind of put on hold because they said the persons responsible for it were put back on the floor. So we're talking about, and this is another concern, but I'm sure, the doctors might share, is we're talking about medical or nursing professionals that are dedicated to administrative, because they're very competent, and I know them and they're super competent, but we are recruiting them for these administrative positions. And then when we need them on the floor in surges, they get dedicated back to the floor, or we need them on the floor. I guess that's just our reality, is we need nurses on the floor as well. So I would rather pay the nurses and keep them on the floor. That's the direct medical care. I would pay them as much as we possibly can because I want to keep them there at GMH. I think we should have our best and brightest nurses there at GMH and pay them what they deserve, and keep them from being recruited elsewhere, and keep them happy, and keep them working hard, because they are working very, very hard, and keep them on the floors where the direct patient care. This Yeah.
That's why it's
It just-
insulting.
yeah,
I mean, it's
it's-
insulting, Speaker.
Mhm.
It's so insulting that we're going
For
to...
program coordinators to get paid way more than nurses.
For them to create these, I mean, to me, if you already have an assistant, you don't need a deputy assistant administrative position.
Right. Well, the statute requires it that if you're going to recruit above step, that you put in writing documented recruitment difficulty, meaning you have to have tried and to recruit at the regular steps, right? And or exceptional qualifications. So that's what I'm afraid of, is that they're going for these exceptional qualifications in particular individuals, but are those really necessary, or are they just catering the job to those particular individuals? So that's the question that I have for the oversight hearing coming up in December.
Well, I could answer it for you now. Yeah, they are totally catering these positions for people. And I want to go into...
That's unfortunate. We have so many issues again that, I hate to see GMH be criticized again for this type of thing. This has happened in the past over the years. Yeah. So many doctors complain. You see them write letters to the editor about the staffing at GMH, and they think it's, admin heavy, not medical professional heavy, which it should be, and we all want. Yes.
And that's what we see. And, I don't think it's fair and I think Sharon Davis, in the board nominee in the hearing, said as much, where she kind of said, oh, we need a PIO because there's all this negative news about the hospital. And so, the administration used to have to respond to that, but now we got a PIO. But when you look at what the PIO does, they make an Instagram. It's almost like they hire this PIO to distract us from the issues that we know exist at the Guam Memorial Hospital. And it's almost like you're paying someone to spin and only put out positive information. I don't think it's justified when we're short nurses. When, you know what I mean? You could pay 2 nurses for this person's salary.
Well, I know that GMH has had a PIO kind of position all these years. I remember Martha Sudo. She was that for many years when I was younger. But this is the issue for me. It's I actually appreciated Lillian Posadas coming directly and talking to the people directly, telling us exactly what was going on at the hospital. I really appreciate hearing from the directors themselves, because you gauge competence, based on their responses, whether they're being transparent, whether the directors are really up on it, right, or not. Mm-hmm. Otherwise, the PIOs, it's like they always have to learn about it from the experts. And I just love government where we can get the experts themselves to come and tell us directly what's going on in that agency. In fact, when we get directors that come in and are willing to answer all those questions, I really feel like those are the competent directors, because they're confident, they're on top of everything, and they know they can answer all the questions that will be posed to them. And I think that's what we should be shooting for. Not how to sugarcoat anything, not how to make anything prettier or, look better. Because you see this a lot now that we have social media. Everybody wants to be hiring someone to put on social media stuff, but I just think that the facts are much more important. For example, look, we can't get the CMS, facts. Even one of the issues I have with the confirmation, and not for this particular person, but on GMH confirmations, I always ask these board members kind of like, how much do you know, right? Do you know everything? Do you know that the GMH did not even request for capital improvement funds in their budget this year? Do you know that GMH requested less operating funds than they did in the past years? Are you aware of these things? And almost these board of directors come in and often say they're not aware. And we are relying on them on a daily basis, on a weekly, on a monthly basis to really have a handle on GMH's just long-standing issues. And they're going to have to, be tough in there. I think they can't say, oh, we weren't aware of the budget process, and we weren't aware that, the administration is telling them one thing in their meetings, like, oh yeah, we really want capital improvement money. The legislature is giving us none. They're not telling them that they have requested 0 from the legislature, 0 for capital improvement projects. And they haven't told these board members that, what exactly were the CMS complaints in all cases, right? So the board members are unable to tell us And I think, so then, we have to,
Yeah.
I just don't like this kind of, I feel like we've got governing boards for a reason. They should be more up to speed on these matters than me. I'm another level. I'm a legislative oversight, yet, I listen to their board meetings, but they need to know more than that. I think these board members, they need to know much more than that. They should, I don't care what their specialty is on this board or what their committee is, they need to be in the know on every decision they are making. For example,
Madam Speaker, stand by. I'm sorry, we got to jump over the top of the hour. It's just too hot to stop now. 8:01, Wednesday, November 17th on The Breeze. We're KUAM FM in Agotnya, Guam, KUAM TV. Here we come. Good morning. We're back. It's 8:01. The link. Miss a lot. The hot topic this morning, above step recruitment that appears to be, at least in our opinion, unjustified going on at the Guam Memorial Hospital. How dare you use this pandemic as cover to hire people 17 steps above what they should be paid if they even deserve the job in the first place. And we were talking about, and it all kind of started with this above step recruitment of a PIO. And we had there was a board nominee hearing for GMHA board nominee Sharon Davis. And she had said that, the PIO is justified because, the employees, they don't like going to work at hospitals falling down around their ears. But I would say, and I want to kind of use this example of Rev and Tax where we did this story on this $11,000 raise. I was down at DRT Friday. A lot of the staff were coming up and they're just saying, thank you, KUAM, for reporting on that. We had no idea. We're mad as hell. We feel overlooked, unappreciated. We don't want $11,000 raise, but we'd like a little something. And so I can only imagine at the Guam Memorial Hospital, if you're a nurse who had to go to school, who's in there trying to save lives on the front line, and then you find out some PIO is making twice what you're making, that's not good for morale. And I don't care how many Instagram posts you're going to do about it. But let's get back in here with Speaker Teresa Terlahi. And we were talking about the CMS visit. We did also try to ask about the CMS visit, Madam Speaker. However, we were told by the PIO that there was nothing new about it.
Nothing that they can release because CMS has not released a final report, right? Something like that.
Yeah,
and
yeah,
that's the kind of runaround we've been getting for years. It's like sometimes they'll tell us what CMS is looking at, and sometimes they'll say we have to wait for the reports. But anyways, I think the bottom line is we need to be careful about limited term hiring. This was another issue I've asked, the auditor has invited us to submit what we recommend he audit, and that's one of my recommendations is limited term hiring. And the other one, of course, is, and now you're talking about above step recruitment, you're talking about creation of new positions, and there does seem to be quite a bit of that going on at GMH, so we have scheduled an oversight for the middle of December. But there's been other hearings that we've had as well. We just finished a health professional licensing office oversight hearing. As you know, this HPLO office at Public Health, they manage about 9 boards. These are licensing boards for the health professions, right? Including medical, nursing, allied health, which includes veterinarians. Yes, they also have a licensing board for social workers, cosmetologists, the emergency medical response personnel, and others, dentistry. So anyways, the theme of this hearing was I was trying to highlight that these boards are supposed to be bringing in, their own fees and have full reign to use their fees as they see necessary, right? So we've heard a lot of complaints against licensed professionals not being addressed quickly, not being addressed at all, or, that there's no process in place. So I wanted to make it very clear at the hearing as to exactly what resources are available to these boards, and showed them that what they bring in, they are supposed to be able to spend as needed And for those who are not bringing anything in because they don't even have fees set up yet for licensing, then that they need to do that, right? And they need to do this so that they can in turn pay for the professionals that they need to help them handle complaints, right? That's the cycle that we were relying on these regulatory licensing boards to do for us. And so I'm hoping that all of the boards left that hearing with a clearer picture of not just their own board, but across the board, the resources that they are sharing, which is the administrative personnel, the HPLO office. They're sharing one attorney general among all 9 boards, and they may be sharing, prosecuting attorneys and hearing officers among these boards as well. They also need investigators or inspectors. And so there's no reason, I think, with the resources that they have, that they can't get these personnel. But I had to have this oversight hearing because we've been talking about this, been having so many meetings with different boards and the HPL office itself. But it seems like the progress is very slow. And so the Attorney General did admit that some of these are like rules and regulations that are at his office for review. So I'm going to see if I'm going to try to talk to the Attorney General Camacho and see if they can dedicate a few more resources towards these boards so that we can get all of the rules and regs updated, all of the rules and regs reviewed, and then move forward with them. Some of these haven't been updated in decades.
Yeah, I was
20 years.
There's 9 boards under the HPLO?
Yes.
And how many of them have a process in which an individual can file a complaint?
Well, they all do, because by default, they all have the administrative adjudication law, which is if you're going to take away someone's license or do anything like that, they're entitled to a hearing. So professionals are entitled to that hearing, and we have a statute in place that governs how that hearing will run. But we've authorized, our laws of Guam authorize each board to also create its own rules and mandate some boards to create special rules for their proceedings. For example, the medical board and the Allied Health Board are mandated to create special rules that include certain procedures, right? For complaints against medical professionals or allied health professionals. So they do have rules. The problem is these rules are old. They're like from the 90s, right? So almost all the rules that have been promulgated in the past are about 20 years old, if they exist at all. And so for those 2 boards, they're too old. They need to be updated. And for some of the other boards, for example, the cosmetology, they've never promulgated special rules for cosmetology, and they need that. And apparently we need a change in statute to allow other schools to also operate on Guam. So that type of thing, I told them, we can't wait any longer. We've been waiting for years, and then the turnover on the boards has been tremendous. I think in this past term, my term here, I've seen a lot of turnover on these boards. So all the work that prior board members had done on updating rules and regulations it gets lost, and they have to start again. So I don't know if you saw the hearing, but one of the chairperson of the social work board, I have to give her a lot of credit. They meet every single Saturday. This is volunteer time, and these are professionals, of course, and they are putting their time into updating their rules and regs. They intend to send this to the Attorney General soon, and I'm expecting this may be a model, way to get this done as fast as possible. That it looks like almost done, and so. But we are in need of social work rules and regs as well.
Is this
otherwise, public health also has inspection duties. The Environmental Health Division, when they license a cosmetology place, for example, they also have their own regulatory roles. That's public health, separate from these licensing boards.
Is this kind of also linked to that lawsuit that Attorney Vanessa Williams had filed?
Yes.
It is. Okay. Yeah.
Yes. Well, the lawsuit also highlighted the fact that I think they were talking in that lawsuit about the Allied Health Board. Mm-hmm. I'm not sure if the medical board as well. But that they were talking about whether they had rules and regulations in place, what procedures were they following on complaints, right? Which has been we've received complaints in our office, and we've tried to follow up with this in our different oversight. We've actually had oversights of this HPLO board. This is our third one, and I don't think there ever been any oversights on this HPLO, which are the licensing boards, right? And but I think it's very critical for us. There have been many complaints about the way complaints are processed. They take too long. They're not getting back to the people who made the complaint, right? They're kind of making a decision that there's no issue there, but they don't get back to the person. Some people have told me they've never even been interviewed when they made a complaint. And so we wanted to see, shouldn't this be uniform across the board for almost all investigation of complaints, right? And how we handle the customer side of that, the consumer side, are we getting back to them? Isn't that standard, based on rules and regs? And we're finding that it's not standard because the rules and regs are all over the place. So I'm hoping that oversight has kind of lit a fire on all of the boards, the HPLO office itself, and the Attorney General's office, and that we're going to get completion of these. I'm hoping in just a couple months. That's my goal.
There was also the paramedics situation, and you mentioned that was urgent, right? Because I think they're almost done, right?
It's an urgent situation because there are some that are not able to get a license under our current statutes, right? So what they need is a change in law, but they said that their proposed change in law is currently under review by the EMS Commission itself. Like, they have to vote on it and decide if this is what they really want. Also under review by their counsel. Counsel said he's working on it. And so, I'd like to act on that as soon as they've decided that's the fix, that's the correct fix for them. And so that we can get more of these professionals licensed. And this is a whole, part of the effort we're going to put more professionals in the community to help us, prior to getting to the hospital, helping to relieve, emergency room visits by getting these professionals out to the community.
Do you know if they ever resolved the issue with the paramedic program? What is it, accreditation?
Yeah, so there was this paramedic program, and then the like the grandparent organization took the accreditation out of this program that a lot of our firefighters were attending to get that national paramedic certification, and so now they're not going to get that. And I haven't been able to
follow up.
Yeah, sorry. I mean, I've been asking, but
I'm just wondering if you heard
update.
anything about it.
You remember this, Speaker?
Yeah, I remember this, and I think it's related to what we're talking about here, but I don't think that that accreditation is something they have to work out, separately. But then what I'm talking about, the change in statute to allow them to be licensed. Yes. Okay. But yes, all of that, we're talking about, we've increased paramedics. The GCC wants to continue for the long term to do these cycles, and so I think it's much needed and very welcome, and we need to do everything we can to facilitate that.
Yeah, well, I just had one more question, and this is
is that regarding the paramedics?
No. I wanted to switch over to original landowners and excess federal lands.
Jinx.
Okay, but
Me too.
Okay, go ahead then.
I'll go.
We have a hearing set for this Thursday at 5 p.m. I've asked Department of Land Management and the Guam Ancestral Lands Commission to attend and answer questions as to, have they informed the original landowners of all of the lands that are designated for return by the federal government to the government of Guam? Have they informed these landowners? And the reason why I brought this up in April in another oversight hearing with Ancestral Lands is because I was very concerned that the government of Guam is making plans for some of these properties that is going to bypass the return to the ancestral landowners. And this is a huge policy shift, I think, from the laws that we have in place that say government of Guam gets the land, they're going to deed it to the Ancestral Lands Commission, and the Ancestral Lands Commission is going to return it to the ancestral landowners for all the reasons that, for decades, Guam has set in law, in policy, for justice, to address the
Injustice.
The takings of lands that were not compensated appropriately, right? And so those findings were made prior to me, and I think they're still valid. I think they're very valid, in fact. And I've met with many landowners who they've not received any calls up to now from Ancestral Lands Commission or Department of Land Management as to the government's plans for their properties, even though their properties are on the list of lands designated to be returned. Most of these lands designated to be returned now have dates looking, well, the military has said 2022 to 2026. It's kind of a very general return time frame. But 2022 is right around the corner, so it could hopefully be sooner, right? But my goal with DLM is we've heard a lot about these land returns actually being very almost final, and that DLM is in the midst of negotiating a lease or a license, for example, for Eagles Field, instead of just deeding it over to the ancestral lands. That they're negotiating some kind of license for use of these properties by the government of Guam. So a license between government of Guam and the federal government. I'm concerned about that. I don't want any, bypassing of these ancestral landowners. And I don't like that their properties are being discussed and used without them knowing. So I've had many of them come to my office. I've met with them. They show me exactly where their lands are. They tell me every transaction that has occurred in regards to their lands. And I've invited them as well to this public hearing, and anyone else who's listening, if you have lands that are designated in the 100 acres surrounding Eagles Field that may be licensed to the government of Guam by the federal government, you are welcome to attend this hearing and give your input. There are also other lands slated to be returned, and I gave the Department of Land Management a list, of course, from the DOD list of lands that may be returned. These include USO, the beach, the Maui Tunnel, some of the others.
Yeah, there's a lot. There's Tangisan, Madam Speaker.
Right,
I think there's also
Tangisan Beach Park. Right.
Tumon Tank Farm. There's a lot of properties that are currently in the process of being transferred back to the government of Guam. But you know what I find interesting about it, Madam Speaker?
So we put this up in April in our hearing. We put this up so everybody would know if that's their property. Right. You better get in on this and pay attention to what the government intends to do with it, because I don't think they intended to return some of these to these original landowners. I've heard of other plans for UXO, for example.
Wow. Wow, that's so insulting. Because what I wanted to bring up was that I think we both sent the same FOIA. So the governor had, and she mandated to write DOD and say, hey, what excess lands do you have? What's the status of it, right? So she actually got a list in 2019 and then an updated list in January of this year. But it really boggled my mind why that was never disclosed to the public. I mean, you disclosed it at your April hearing, but I don't understand why the governor would sit on this, because it's such good news for original landowners that they're getting their land back. Land back is huge. You guys, I mean, it's land back. It's indigenous. It's what we're kind of like all about. And
I can't speak for intention, but this is my worry, and this is why I brought it up at the hearing, and this is why I had a hearing. It's kind of like, because they may be returned to the government of Guam. That's the DOD's obligation. They return it to the government of Guam. But what the government of Guam does with it, that's the missing link here, right? What is the government of Guam's intention? And I can't believe this is the hearing we have to have, right? For me, that's kind of mind-boggling. It's kind of, I don't know. I feel like this is unprecedented, that we are questioning the government of Guam as to why they're not following their own policy or whether they have other intentions, right? So I'm going to, we'll see what happens at this hearing. I know that it's been difficult. We've only received documents through FOIA. And FOIA, you have to ask the exact right question, or you're not gonna get all the documents that they have. As I've said many, many times, this is not the way to run a government. If they want to be transparent, all these documents should be available. They should be, even the Guam Ancestral Lands Commission has not been part of this loop, when I talked to the director. So, and I've told him he's got to go and take a look, but Department of Land Management for sure, that's why they're being called to this hearing as well. Apparently, they're one of the people negotiating a license with the federal government, and I've never seen that done before either, So I'm very curious how this is going to work and what kind of authorities that they're going to rely on to do that.
Wow.
But I am hoping, what I want is, I want everyone to know, I put up the list, they're on my website, of all the lands the military has promised to return. And these are promises made since, 2010 at maybe even earlier than that, right? They've promised this list of land to be returned. They've included additional lands, like now it's 100 acres instead of 50 acres at the Eagles Field, okay? That's a big shift. And so I want all the landowners to be aware of it, and I want them to have their say, that if the government of Guam is making policy decisions that are different than what we've said in the past, that all these landowners should be aware and they should have input. So I'm trying to give them a forum to have input. I'm also trying to give a forum to Department of Land Management to explain their role in perhaps the other uses for these returned properties that the government of Guam has in its sites, right? We know about the hospital use, but what is their other intended use of these other properties? Yeah. Why are they not bringing the Ancestral Lands Commission into this process?
Thank you, Madam
That's
Speaker.
fun. That's a big hearing
That's
coming
huge.
up.
Yeah. So from above
Yeah.
step recruitment to land back that's not above board, I think we covered it all this morning. Thank you for your time.
Thank you.
Thank you.
Okay.
Good luck.
Yeah.
Can I say that, this is diabetes awareness week, I think month, right? And I attended a diabetes conference over the weekend, but I also wanted to point out that we've just had a hearing on a couple resolutions that are to support these bills in Congress that are going to cover Agent Orange, right? That are going to recognize finally this presumption that Agent Orange, that the veterans on Guam were exposed to Agent Orange, and also perhaps the civilians that worked in these areas were also exposed to Agent Orange. Diabetes is one of the illnesses that comes from exposure to Agent Orange. And Guam has a huge diabetes issue. It's complicated many things, and especially COVID, right? I mean, it complicates any disease you have, heart disease and COVID. We've seen many deaths with people who've had this diabetes when they get COVID. So I am just hoping that, we talked last week about the RECA and the radiation exposure and cancers. Yeah. And I just want to highlight that we're also going to be bringing up during our session this Agent Orange exposure, and we really hope we were really supported with this Military Veterans Advocacy Inc. organization, who is very active in advocating at Congress and for this Agent Orange. They also cover the burn pits, right? And we've learned that on Guam, they're stopping burn pits everywhere because of the dangers, the toxins. Yet on Guam, we're learning they want to continue burn pits. So we are also putting in a special petition to ask them to stop.
This could easily turn into another 30 minutes, Madam Speaker. But I wanted to say that I was watching because they made a big to do about how this infrastructure bill was bipartisan. So we were watching the news yesterday, and they had interviewed somebody, and they were talking about what's the next big bipartisan effort, and they mentioned the measures that you're talking about, the Agent Orange exposure. So it does seem like these are just going to plow through. It's great.
Yeah, these are to take care of veterans everywhere that have been exposed to toxins, either at Inuitak radiation, burn pits, or Agent Orange, right? So good for the veterans. And we had our hearing the week of Veterans Day, and I was so happy for the support that we received for those who were brave enough to tell their stories of their families suffering from these diseases, for the Veterans Advocacy Organization, for Brian Moyer. Remember, he came out here and helped US EPA find us exact sites to test based on veterans' testimony, sworn testimony. And of course, Mr. Robert Celestial, who's always helped us to find the documents related to Agent Orange on Guam and to advocate for inclusion of Agent Orange and radiation coverage.
Thank you, Madam Speaker.
Thank you.
Thank you. That's that. Okay. Hey, let's keep it going here. It's 8:25, Wednesday, November 17, 2021. Miss a link, miss a lot. Let's go ahead and get into our 8 o'clock newscast brought to you by Pacific Points with the very latest from the KUAM News team. Sabrina Salas-Matanani, good morning.
Off it, everybody. We could see the easing of restrictions in the coming days. We'll have more on that later. But first, the Joint Information Center reporting the island recorded 2 COVID-19 related fatalities. The 259th occurred at GMH on the 15th. The patient was a 66-year-old man unvaccinated with underlying health conditions. He tested positive on October 9th. The 260th occurred at GMH on the 16th. The patient was an 80-year-old man unvaccinated with underlying health conditions. He tested positive on November 3rd. 28 people hospitalized for COVID, 4 patients receiving ICU level of care, 1 on a ventilator. Out of the 28 hospitalizations, 18 vaccinated. Only 10 unvaccinated. Public Health reports 41 new cases of COVID out of 1,222 tests performed on the 15th. 15 cases identified through contact tracing. To date, there have been a total of 18,983 officially reported cases. Again, 260 deaths. 1,807 cases are in isolation and 16,916 have recovered. The CAR score, 3.3. As of November 15th, the total of 124,658 of Guam's eligible population, that's 5 years and older, is fully vaccinated. According to GDOE's daily COVID-19 report for Tuesday, there was only 1 new case of COVID, and it was an employee at Estumbo Elementary. Meanwhile, the CNMI reports 6 positive cases of COVID since October 28th. There have been a total of 108 new cases, of which 75 were identified via contact tracing, 25 through community testing, 9 via travel testing. The total case count in the CNMI since March of last year is 399. With more news now, here is Daniel Perez.
This news update is brought to you by Pacific Points. Do more, get more.
Half a day and good morning, everyone. I'm Daniel Perez with your headlines here on The Link. U.S. President Joe Biden signed a $1.2 trillion infrastructure bill into law, the most expensive in history. A ceremony was held on the White House lawn to mark what was billed as an historic event, and Governor Leon Guerrero was in attendance, along with a group of fellow governors and congressional leaders.
To state the obvious, none of this would have happened without all of you. I really mean it. And also to the governors. Where are the governors? Governors, stand up. Come on, I want you to stand up. Red states, blue states, you all contacted me. You all said you were for this. You all stepped up.
Adelup issued a news release saying the White House invitation was received right before Governor Leon Guerrero was scheduled to return home from New York. She previously said she was going to Wall Street to meet with bond raters to encourage a boost to Guam's ratings. Adelup said the governor was among a select group of bipartisan leaders and key business representatives from across the country who were instrumental in the negotiations leading up to the bill's passage. She's quoted as saying, "It's a tremendous honor to represent Guam and the territories at this historic ceremony. Guam stands to receive $193 million to improve and modernize local infrastructure while developing new opportunities to address the climate crisis." Leon Guerrero added, quote, "The resources will go directly to addressing our infrastructure challenges, such as roads, bridges, village streets, and broadband. More importantly," she said, "this bill will provide quality jobs for our people." For Guam's News Network, I'm Nestor Lecanto.
Some $100 million will be used to repair Guam's crumbling roads. We reached out to Public Works for more detail. We hope to hear from them soon. As the holiday season draws near and family and company Christmas and New Year's gatherings are expected, what are the chances that restrictions on gatherings could be eased? Pretty good, says Dr. Nathaniel Berg, the chairman of the Governor's Physicians Advisory Group. He says they're encouraged by the latest data showing a great improvement in containing the most recent surge.
The light is clearly there at the end of the tunnel, and I think it won't be too long. And actually, I feel very confident that if we see this trend staying without numbers bouncing back up for some reason, that the restrictions will be loosened shortly. Of course, the governor has the final say in that, but she is inclined herself to start to release the restrictions soon.
Dr. Berg could not say how soon, but once the governor does make a decision, he says any changes to the current mandates will be gradual.
Social gatherings, the number will go up. It's extremely unlikely that it's going to go up to 1,000, so that some of the giant weddings still maybe be put off for a while, but for sure, the social gatherings is likely to go up. No, I can say pretty confidently. That's one thing that the governor wants. And then looking at the changes for the restaurants as well, to be able to get people to feel back to normal. I think those are the two highlighted areas.
Dr. Berg continues to urge the island to get booster shots and for parents to get their children 5 years and older vaccinated. You can catch the full interview tomorrow on The Link. Is an above-step recruitment for a hospital PIO above board? Is a PIO critical to hospital operations? These questions and more for a GMH board nominee. Here's more on this report.
The Guam Memorial Hospital now officially has a hospital marketing and communications director, aka a public information officer, and GMH's PIO is making $15,000 more than a starting PIO makes because of an above-step recruitment requested by hospital administrator Lillian Posadas. The hospital PIO also makes the same amount as the communications director for Adelup. GMH documents show that the new PIO requested a salary of $161,000, but Posadas instead hired her at pay grade Q7 for a salary of $75,600 a year, not including benefits. PIOs in Gov Guam usually start at pay grade Q, making $60,000. According to the documents, Posadas' justification for the above-step pay grade was based on, quote, exceptional qualifications. Meanwhile, Senator Joanne Brown questioning GMH's need for marketing.
To do an above-step increase for a marketing position, a hospital marketing and communications position. To begin with, I didn't know the hospital needed to have a marketing position. I mean, it's not like we're in the private sector and we're trying to market, our business.
Speaker Therese Terlahi raising the issue of the above-step recruitment at a confirmation hearing for GMH board nominee Sharon Davis. Davis telling senators she thinks the marketing position helps boost employee morale and the public's confidence at GMH, given the less than desirable conditions there.
Nobody wants to go to work at a place that is constantly being questioned and pounded down all the time, like you're not smart enough, you're not good enough, the roof is leaking, the elevator doesn't work, the Z-Wing needs to be demolished, our HVAC system is broken, the cafeteria is old, there's towels on the floor kind of a thing. I felt that it was really important that our community felt that it wasn't just bad news coming out of the hospital all the time.
GMH docs show Posada supported the above-step pay because, quote, Ms. Habib brings with her years of management and journalism experience. She has a master's degree in public policy and a bachelor's degree in journalism. Posadas calling her, quote, an invaluable asset to GMH. May Habib was originally hired at GMH in May as an unclassified management analyst 4, but she's now in a classified position as the marketing director. While Davis said marketing the image of GMH would boost staff morale, even calling the PIO critical, Senator Brown disagreed.
I think you're going to have employees that have been working there a number of years, probably didn't get an above step, and are performing critical work, are probably upset.
A review of GMH's staffing pattern shows a staff nurse makes $36,000 annually. An ER nurse starts at $41,000. A staff nurse 2 makes $43,000. A clinical nurse wound care supervisor makes $66,000 a year. And a respiratory therapist makes $39,000. For Guam's News Network, Chris Barnett reports.
A friendly reminder was sent to Administration Director Edward Byrne that the legislature still can't review real-time data from the government's financial system known as AS400. Senator Jim Moylan says the budget law requires DOA to provide senators with read-only access to accounting and budget modules. He says the provision he successfully added to the bill is meant to provide greater transparency over Gov Guam expenditures. In particular, he wants to know more about how federal assistance money is being spent.
The federal money is hers. Well, that's fine. So if you want to spend it, go right ahead. But we're going to look at your checkbook. And that's what I consider the AS400 to do. We want to see the debits and we want to see the credits, right? And then we're going to watch per department where that spending is happening, so we can track on a daily basis. We can watch these finances, and we can see a peak or a minus to see where things are going.
He says for months the legislature has been asking to know more about the governor's plan to spend. He says at least they can track what she has spent through the AS400 access. Senator Moylan sent a letter to DOA Director Byrne seeking an immediate response on what steps will be made to provide senators with access to the financial management system. That's it for now. We'll see you tonight for KUAM News Primetime.
This news update is brought to you by Pacific Points. Do more, get more.
In regional news, there are major changes ahead in the travel protocol for incoming travelers in the CNMI. If you are fully vaccinated and living with fully vaccinated people, you no longer need to quarantine. Tomas Menglotnya reports.
Well, because we don't want to quarantine you if we don't need to quarantine you. So we want to get to the information. If you can't provide it, we will help you. We'll make the contacts ourselves.
It's the sharpest pivot yet amid a rise in community cases and an aggressive vaccination and contact tracing effort. New guidelines for entering the NMI are expected to take effect on November 19. At a summit with 3 branches of government and private partners Tuesday morning, the COVID-19 task force announced that if you are fully vaccinated and those you are going to stay with are fully vaccinated, there is no quarantine. But you do have to be tested for COVID-19 on your 5th day. If your household is unvaccinated, you're subjected to a 5-day quarantine in a government facility, and if you're an unvaccinated traveler, you quarantine for 7 days. Those living with individuals ineligible to receive the vaccine will be addressed on a case-by-case basis.
Our focus with this change is about contact tracing, surveillance, and testing. We want to ramp those up, but we can't if we're doing everything else on the border with testing on arrival and testing on day, basically testing everything.
The governor is meeting with the Hotel Association of the NMI today to discuss how this impacts current specialized tourism programs.
Done everything we could to prevent and to keep CNMI safe. Again, we wouldn't be here if the collaboration and cooperation from each and every one.
The change comes as vaccines for children continue to roll out and the economic costs to run a quarantine facility mount for both the government and community. Having gone without COVID-19 longer than most, they're confident they're prepared to take this next step.
This is a step forward in terms of trying to support our businesses and being able to allow entry of those spenders, those patrons to our small businesses more quickly, more rapidly into the community instead of that 5-day delay.
Tomas Menglotnya for KUAM News.
All right, let's take a look at what's making news around the island in our native tongue. Here's Chamorro News Update.
Buenas tardes, tigetsun to gifinut sa morgin ni KUAM News. Presenta ni Familian Mizo gi First Hawaiian Bank. Afirma si Presidente Joe Biden na di 1.2 trilyon pesos na bio-infrastructure no ninaalay. Iseremony para ifinin man Biden na dyan na bio sa masasede gihad din gimena ni White House. Ibio sana sa 93 milyon pesos para project siya ginigizagwahan. Sigon ni press release gin ni Democratic Party of Guam, kasi 100 milyon pesos guhin na sa lapi. Umanaw gati para mafamalik sa lanta, 11 milyon pesos para transportasyon publiko na sistema, sa 25 milyon pesos para manamar sa dilanto distribution broadband internet. Pag-usiya naman sa pumaresibi kasi 110 milyon pesos. Makumbira magahaga Luliang Guerrero para attende ceremonian finidman Biden. Mas asunto, sisiga di booster clinic siya makontinua gunigi islata. Gidedo Senior Citizen Center gi martes kadumi man matugatugi para maakumpli mas pernitehi para siya kontra coronavirus. Umpison na nutato dedo si Francisco Ong sa uno ni San Miguel naman matugwihi sa explica na madulog ni booster para upritayin may sagwi e familyan niya ineta dyan ineto siya dyan todi manggagigyo rizanya. Esa 13,451 na residente ni isla sa man madulog ni Pfizer na booster. Dyan 6,699 sa man madulog ni Eminatres na amon Moderna. Man mamayla na booster sa Paraguato gi Jim gitahagat di silas 9 giegan sa las 12 gitaloani. Yuto mo na sunto gifinut sa moro para pago na Merkules gini KUAM News. Mananaw notisya Direktor di Departamento ng Administrasyon si Ed Byrne ni Legislatura para masanganin na destipago ti sinya mara bisita i real-time data gini System and Financial o gobernamentong gohan na mafananan AS400. Ilinga si Senador Jim Moylan na ilagi budget sa demanda na DOA humanai todi Senador siha na fanhalong gwi na sistema para mali accounting and budget i gobernamento na informasyon. Ilinga nesti na probisyon na nasano gibiyo niya sa puro mas ngulo hinanaw niya ikas ng gobernamentong gohan. Especialmente sa pagtaymano magasta di sa lapi federal para inasisten ni Tautauta. Ilingan na pod meses na tempo mamamaisin legislatura mas informasyon pura plano niya goberno taymano para gasta estisya na sa lapi. Masasangan na kumumamatetso azo na sisteman AS400 sina masesa natan hafa magagasta. Ananaw si Moylan kata si Byrne na fafay sa no respondo in sigidas nitamano por man na siguro na sina sa nadot siha umana sabi financial management na sistema. Para Guam News Network, Golsikin Conception. Yasuto Finutsamoro sa presenta sa ninafatto ni Familiang Mizo di First Hawaiian Bank.
Say hello to the First Hawaiian Bank mobile app. Want a better look at your spending? With MoneyMap, you can automatically create budgets and manage where your money is going. Know when you have a green light or when it's time to slow down. Maybe cook more meals at home this week. Set your goals, track your progress, and find your way to exactly where you want to be. With MoneyMap from the First Hawaiian Bank mobile app. It all starts with yes.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
Mariana's Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutters, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Mariana's Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Mariana's Irrigation and Landscape Superstore.
Do you feel like you're missing out on something? Make life more rewarding with Pacific Points. Earn and redeem points for bill rebates and free load at IT&E, discounts on fuel at Shell, vouchers at Foodies, and United Mileage Plus miles. You can even pay with Pacific Points at IT&E, Shell, and Foodies. Pacific Points. Do more, get more.
And Jack in the box, 8:45 right here. Good morning. Let's go and get right into it. We do a Wednesday check-in with Superintendent John Fernandez. It's our education update, our progress report, like Sabrina likes to say. And he was off island last week, so we got a bit of catching up to do. So good morning to GDOE Superintendent John Fernandez in the KUAM News Link Zoom room. Good morning, John.
Yeah, happy day, Chris, Sabrina, Jason, and Isaiah. There's a lot to catch up on, wherever you want to start. But I did, yes, I was off island last week. Part of it was to go to the annual policy forum for the Council of Chief State School Officers, and then also to meet with our partners in USDOE in DC. So it was very productive. I think productive in many ways. I appreciated the opportunity to really touch base and see and share what was going on Guam with my colleagues I mean, these are the other state superintendents for the other 50 states, as well as territories. And this really was a unique opportunity. It was the first time the council had come back in person since 2020. And just listening to what other states are going through, how they are moving through their decision-making processes, really gave me I think both a good picture of where we stand on Guam, as well as I would say reinvigorating my commitment to try to get us back to 5 days of instruction for all of our students. I mean, there was a whole range. I was on a panel, on the main panel for the conference, and I was talking about our experience, here on Guam, starting up, stopping again, and trying to restart and build confidence back in, amongst our stakeholders in getting back to 5 days of instruction. And to my left was our Tennessee commissioner, who said, "Oh well, we never closed." So you had a bit of extremes, across the country. But again, there were a lot of common issues as well that we're dealing with: learning loss, dealing with the social and emotional strain that is being placed on students, families, and definitely on employees. Real interesting cases in leadership, depending on the different politics that are affecting different states. So that was good. I think we announced on Guam that I was elected to join the board of directors for the council, and so I'm really thankful for for being asked to serve and to be able to provide a voice for Guam on that national stage. So that's something that we'll be able to do for the next 2 years. And then, of course, on the way back, I stopped in Washington, D.C. To meet with our risk management folks relative to our high risk and special conditions issues. I mean, as you know, over the last couple of years, as the pandemic has affected us, it's also affected US DOE and its activities. And I've been concerned about the loss of momentum in terms of trying to address these special conditions and get US DOE to visit and give its blessing to help remove some of these special conditions. That hasn't been possible because they've only been able to do virtual monitoring. But we did have a meeting, and I think to our surprise, and I think to the staff's surprise, the Deputy Assistant Secretary who was invited joined us. And I don't think anybody was sure whether he would attend. So we were happy to meet and discuss our situation with Deputy Assistant Secretary Phil Youngst. He is actually the head of the audit and risk management functions for the U.S. Department of Education. And he's just recently in that slot since the new administration has come in. So he was very interested in our making the case. Clearly, there's a bigger, there are challenges that are happening in Puerto Rico where a third party is also involved. And I think they're looking at Guam as to how we can complete this roadmap so that they can take the lessons learned and the best practice and use that in a much bigger situation in Puerto Rico. So we had that discussion, and I think the product of it is that we have a commitment to get an on-site visit this spring. So we were anticipating a virtual monitoring in January, but there are certain things in our reconsideration plan that are not going to be removed without an on-site visit. And so there isn't any travel. I mean, there isn't a lot of travel going on to the territories for sure from USAID, but he did commit to try to set up a spring on-site visit. And so we're really looking forward to that as a way to pick up the momentum and get some of these decisions made prior to next summer. So I'll go ahead and stop there. I mean, there might be some discussion. I know that we did talk a little bit in the media about plans for returning to 5 days of instruction. So right now, the proposal I have on the table is a return for high school on December 1st, and then the return for all schools in early January once we return from the holidays. And again, as you know, there are a lot of factors that go into that decision. Clearly, the governor has already authorized all schools to reopen based on our assessment of our ability to operate operate safely and, and again, address the learning needs of our students. So we are, over the past several weeks, we've been monitoring the community safety, indicators, and it really, it looks like we'll be out of a high risk situation within the next week or so. And we're tracking that. The positivity rate is already at a low risk level. The number of cases probably has to come down a little bit more. But by the time we hit the target date of December 1st, we should be back in a lower risk situation based on the CDC framework, which we indicated was going to be our roadmap for how we approach the risk at our schools. That'll allow us, to move forward with reopening. The reason we proposed high school in December was because, the vaccination rate for 12 to 17-year-olds is already at about 75% and higher for the high schoolers who've had the opportunity, earlier to get the vaccine. So, we're seeing that as an opportunity for the high schoolers to be able to come back first. And then, with the 5 to 11-year-old vaccinations being pushed out, giving our families the end of November and December to take advantage of the vaccination opportunities, we hope that'll give families the choice of getting that vaccination before they return to school in January. I do want to say, however, that we are still in active discussion with several board members who are, some of whom are actually pushing for an earlier start for all schools, possibly by the beginning of December. So we've indicated, that if the board would like to go in that direction, then we need that to be decided by our next board meeting on the 23rd. We do have a couple of input sessions for our stakeholders coming up, I believe, tomorrow and then next Monday, to be able to share the plan, get some input and make some final decisions. But again, the priority for GDOE, now that we are in a safer position to reopen, the priority is to get back focused on teaching and learning and make sure our kids don't fall behind their counterparts on the mainland or in the rest of the world. So that's something we're going to be communicating and sharing with our stakeholders. We anticipate there will be some pushback. We know that no matter how the situation looks, COVID-19 has had a dramatic impact on the community, and I know that people are always going to feel, that they're, anxious about, getting back to normal. But it is important to recognize our job and our commitment to getting kids back into school. We think we can do so safely, and we plan to make that case as we get into the end of November, early December.
John, do you think that
I'll go ahead and stop there and take any questions you guys have.
We actually have Isaiah, our education reporter. He's in the Zoom room, and
Good morning, Superintendent Fernandez, and congratulations on your election. I wanted to ask, Guam Education Board member Maria Gutierrez made a comment about the rough conditions some school facilities are in. I was wondering, is there a plan to take a tour of these schools, or what can GDOE do to, improve the conditions they are in?
Well, if anybody knows the conditions of our schools, is Ms. Gutierrez. She's been on the board for, forever. And she's known our budget situation. She's known our school facility situation. So, I take her observations as a continued call to action for resources to address our facilities. And we're lucky that we do have federal funds that she is well aware will be dedicated to addressing canopies, addressing, the other needs of the schools. So we're working with her and our federal team and our Army Corps of Engineers, consultants and so forth to get that plan rolling so that we can begin to make some of those fixes and those repairs that have not been able to be done, in the past because of some of the resource issues that we face now. So we look forward to that. I mean, just as we head into this next, board meeting, we're probably going to be talking about our budget situation. And as you know, if you look at our budget that we got this year, our appropriation, we are already, acknowledging that our budget has fallen and is falling short on the operations side. So trying to fund all of our educators and our staff while at the same time maintaining our schools has really been a juggling act and hard to sustain when you've seen a $30 million cut to our local education budget over the past 3 years. So in addition to Mrs. Gutierrez, taking the lead and really calling attention to our facilities, but also, participating in the planning for how we want to expend, and invest those federal dollars, that's going to be really key. And then our chairman and our vice chair, Mr. Mendiola and Dr. Okada, have both really called out the question about the budget. They've asked us to come back with a plan, and we've submitted that plan to our board members for their review. And part of that plan involves going to the governor and asking for additional resources so that we can hire the personnel that we need to hire to keep our schools safe and supervised, as well as to support the essential operations at the school, including maintenance. So we look forward to our chair and vice chair's leadership on the budget side to help us with that request. And again, these are all coming together, based on the budget being passed and based on the commitment to reopen schools, knowing that we do need a lot of support to make sure that everything goes smoothly.
Just real quickly, because we are pushing at the top of the hour, I did want to follow up in the virtual sessions that you're going to be holding with the stakeholders. Will you be discussing the testing policy for students?
I don't have you're talking about the mandatory,
Yes,
the mandatory
yes.
screening testing. So we don't, that's not yet ready for discussion with the stakeholders at this point. So we're targeting in January would be the earliest probably that we would implement. But I know that our team has been doing its research, and there are several questions that we need to clarify before we finalize the plan. So I just returned, but over the time I was gone, there were a set of questions that I know our team came up with that we really need to finalize and answer before we can provide a plan. So again, just to be clear, that is something that has been included as part of our safety measures pursuant to public health's guidance. We don't anticipate, and we have not heard any move to make testing mandatory or vaccinations mandatory. We understand that for our kids and their parents, that it is going to be their choice to be vaccinated or to be tested. So our planning is basically using that as a basis for our starting assumptions. So that's where we're at, and at this point, our focus is going to be on reopening, why we are proposing the time frame for reopening, what the safety factors look like that are contributing to that decision, and then answering any questions or hearing any ideas that might come from our stakeholders at this time.
John, I just wanted to ask, so when we return to face-to-face, are you confident that you have all the measures and the testing and everything you need to stay open in these less than desirable COVID conditions? Like, let's say we see an increase in the, what was it, you called it, the risk status.
Right. We're always going to have to monitor the community risk situation and make decisions accordingly. So, we can't predict what will happen. We do know that we just been through a second wave. I do think that we want, after having operated in cohorts, we believe that was a good strategy to get us back into school through a period of high risk in our community health situation. We're also lucky that we've been able to track cases that have been reported and ensure that there is no spread, within our schools. So as we now come back, even though these are less than desirable situation, it's more desirable than where we were back in September, right? So, we have seen an improvement in the community health situation. So our job now is to get our kids back to 5 days of instruction and to sustain that. And we want to work with the governor not to do any, not to go into any immediate or sudden shutdowns, but allow us the flexibility to, to perhaps go back into cohorts should the community situation get worse. One of my big concerns is I am hearing that the governor is considering relaxing restrictions. And, my concern is that happened back in July, July 30th, just a week and a half before we started schools, and we started to see the cases, rise, prior to the start of the school year, which really complicated, our ability to open up and then keep our stakeholders confident that we were keeping our kids safe at school. So based on what we've learned, though, the spread was happening in the community, happening in the households, and because of that, it impacted our ability to keep our community confident that schools could remain open. So we hope that doesn't happen again, and we hope that schools will, the opening of schools and the continued, focus on education will be a priority, going into this next set of decisions about the restrictions on the community. We hope that keeping schools open will be, a top priority.
Thank you, John.
Thanks, John.
Oh, sorry. Before we go, we wanted to recognize our friends over at KFC. Can we pop up those pictures? John, I don't know if you saw this, but it's related to our conversation we had with board member Miss Maria G. Last week. Yes. Mrs. G. So she was able to finagle a cool donation out of KFC. They donated to 50 umbrellas to Finnegodson Elementary School. I'm just laughing because I can just imagine Mrs. G like, "You gonna donate the umbrella or what?"
Yeah, I know. I saw that. I'm really thankful to KFC for their their contribution. I mean, I do my best to to contribute to KFC and get their hot wings. So I feel like I put that investment in. But no, really, I do want to thank them for responding to the call and at least providing a temporary solution. These canopies that we're talking about really do take. I mean, we're talking about rebuilding the canopies versus putting plywood back over it, over these things. So it'll take some time, but it is amongst our priority projects for the American Rescue Plan funds. So we'll be working with Mrs. G to make sure that we have that permanent solution in place.
Thank you, John.
Thank you.
All right, thank you, and thank you, KFC.
All right, on. There you go. Hey, it's 9:03. We're going to take a quick break and come back. We're going to go in with diabetes, right, as we're doing all week long. It's 9:02 on the link. Good morning. The show continues next.
We all know that a healthy lifestyle is important to prevent chronic diseases and long-term illnesses and boost mental health. It's difficult to determine exactly which healthy habits are worth investing in to live longer and healthier lives. But FHP is here to help. Tune into the link every Tuesday for FHP Hoffa Health Tips, brought to you by Take Care. Helpful advice about healthy lifestyle choices that will have a big difference in your health from the medical experts at FHP Clinic. FHP Hoffa Health Tips on the link every Tuesday is brought to you by Take Care.
Uno Mixed. We're mixing it up on the last Thursday of every month with a look at lifestyle, entertainment, food, and so much more on the stations, networks, and digital platforms of KUAM Communications.
Uno Mixed is presented to you by Docomo Pacific, Better Together, and Pepsi. That's what I like.
1 in 6 people on Guam are affected by diabetes. The terrible impact of the disease on the island has only been amplified by the COVID-19 pandemic, as many of those hospitalized and those we've lost had pre-existing underlying conditions like diabetes. As November is Diabetes Awareness Month, KUAM News has partnered with AI Health to raise awareness for this disease that affects so many of us and to showcase a number of ways to prevent, treat, and care for those with diabetes. Join us for AI Health's A Healthier You, Making Diabetes History on Guam, a multi-platform campaign on KUAM Communications, including a 6-part series on KUAM News Primetime and Weekend Edition, and our digital media platforms kicking off on World Diabetes Day, Sunday, November 14th. Daily interviews with expert panelists on the link beginning November 15th, and a special interactive town hall meeting on the link with experts from AI Health, with more information on their diabetes validation study and a new level of precision care that aims to create a healthier Guam. A Healthier You, Making Diabetes History on Guam, a look at how diet, exercise, and technological advances in disease monitoring and medical care can have a positive impact on our community.
The Healthier You series on KUAM News is presented in partnership with Calvo Select Care and Paradise Fitness Center. Learn about people and organizations making a difference in our community on the greater good every Wednesday during the link. Building awareness, promoting events, generating change. Find inspiration to seek out the greater good every Wednesday. Listen, watch, stream. Miss the link? Miss a lot. Presented by Jay Goodman, a happiness company, and Guam Windward Memorial. Celebrate life.
Let's get merry during the most wonderful time of the year by making spirits bright. KUAM Communications and Coast 360 want to highlight your decorations and lights by flooding the social media pages of KUAM with your videos and photos. Finish your holiday setup, snap a few shots or video of your delightful display, and send it to us through social media or email them to promotions@KUAM.com. Check out our posts every Friday or tune in to KUAM News Weekend Edition for a special montage of the submissions certain to be making spirits bright with every broadcast. Warmest holiday wishes from KUAM Communications and Coast 360 Federal Credit Union. Together, we thrive.
A Healthier You, Making Diabetes History on Guam.
Presented in partnership with Calvo Select Care and Paradise Fitness Center.
Afternoon, everybody. Welcome back to the link. As we've been doing over the past couple of days, we are promoting diabetes awareness on our program. It's part of our campaign with AI Health. And as you know, over the weekend, we started off with hearing from Governor Lilian Guerrero. Also, we heard from several different members of our community involved with prevention and making sure that we're eating the right foods. Today, we are talking about technology today with Dr. Erica Alford. She is with the American Medical Center. She's also an AI Health advisor, a member of the AI Health Clinical and Technical Oversight Board, and principal investigator for diabetes study on Guam. She practices at the American Medical Center, as I mentioned. She's also a leading endocrinologist right here on our island, and she was born and raised here. Also with us in the Zoom room, we've got Dr. Juan. She's also an AI Health. He is with AI Health. He's the Chief Medical Officer and Chairman of the AI Health Clinical and Technical Oversight Board. The guiding principle of Dr. Espinosa's work over the past decade has been that data and technology have the potential to narrow the health gap faced by underserved communities all over the world. So thank you both for joining us this morning. He's the Chief Medical Officer and Chairman of the AI Health Clinical and Technical Oversight Board. The guiding principle of Dr. Espinosa's work
I wanted to
over
start
the past
just
decade
to kind of
has been
contextualize
that
this.
data and
Both of
technology
you
have the
doctors
potential to
have
narrow the
a
health gap
vast amount of experience
faced by
with
underserved
and appreciation for the use of data
thank you both
when it comes to
joining us,
making
this
decisions.
morning.
Furthering your research and your practice and everything like that. Can you kind of talk about what that means as far as the opportunities?
I guess I
when
wanted to
considering
start
large
to kind
amounts
of contextualize
of
this,
evidence
both
when it
of
comes
you
to medicine.
doctors have a vast amount of
Yeah,
experience with
happy to
and
chat about
appreciation
that. So,
for
when we
the
think
use
about
of
data, there's
when it comes
happens
to
at different
making
levels. So I think
decisions,
that there's an individual
furthering
level.
your
So on
research and your
specific
practice and everything like that. Can you
how
kind
much
of talk
information
about
do I know
what
about
that
you
means as
so
far as
that
the
I can
opportunities
achieve more goals
when
and that might
considering
be
large amounts
information that we
of
gather,
evidence
during our
when it comes
interview,
to
during
medicine?
our visits, right? Taking the history and understanding what's yeah, going on with you, it might happy be to data chat about we gather that. from, So,
when we think about data, it happens at different levels. Imaging studies at individual levels. So on specific patients, what's really incredible that I know about diabetes is this more uniquely quantified information that we gather during our interview, changes in blood sugar, as well as the treatment. We can really measure data in very, very finite vitals or blood, and so it's sort of an imaging study, fascinating opportunity, and really bring to bear advanced techniques and data gathering and uniquely quantifying both one person's process or the changes in blood sugar. But if you go beyond one person, we can really measure what is the health very, very finite health of the population. Which I think is sort of this population. How do we gather information about a lot of people? How do we make decisions about how do we change the healthcare that we deliver or the environment that we're in so that the population of people can move together? And that requires a whole different set of data. So not just those individual level data points, but really thinking about data from all of these people and then those contextual data points. So do you live in a food desert? What is the air quality? What is the water quality? Really thinking about communities more holistically. And it poses certainly some data challenges from the collection and analytics standpoints, but I think the potential to really do something meaningful to improve the quality of life and the health of individuals and populations is what's most exciting about it.
And so, Dr. Alfred, as a clinician and everything, empowered with all of this data behind you and everything, does it speed up the process of being able to diagnose and then treat and monitor your patients? I'm sure it would, but how different a paradigm shift has this been? Considering, what the way medicine maybe was practiced like a half century ago.
Oh, absolutely. It has shifted medicine leaps and bounds. I've had the pleasure of working with some patients with diabetes who had diabetes at a time where insulin was delivered through glass vials that had to be boiled before it was delivered. There were no glucose testing kits where the only thing that they had was a urine dipstick to see if they had a lot of urine in their, a lot of sugar in their urine or not. They had no clue what their blood sugar was at any given moment. And in order to get that data, they had to go to a lab and get their blood sugar tested. We have made huge advances. As much as people with diabetes hate poking their finger to get a little sample of blood to check what their blood sugar is, that has changed life with diabetes tremendously. Just being able to know so you can make a change in your life has improved the quality. Now we have devices that continuously check your blood sugar so that we know what your blood sugar is doing minute to minute, second to second. And so this has really helped change people's lives. Just knowing that information makes it easy to say, you know what, that meal was not good for me. Or, hey, you know what, that exercise routine was fantastic for me. I'm going to be motivated to do this more and more because it's really helping me. Just having all that information for the patient makes a huge difference. Now, coming as a clinician who has been a practicing endocrinologist for 10 years and a physician for the last 15 years, it has made such big changes because before it would be check your blood sugar once, twice, 3, 4, 5 times a day and write it down for me. So we had those time points, but that's assuming that the patient could get around to it. Life gets in the way. And then we would use that information to help adjust in medications.
And assuming they don't fudge the numbers just to make the doctor look better.
Just so you know, patients, the doctors can figure it out. I've actually, it's pretty obvious for us. So don't bother lying because it does not help you whatsoever. We can figure it out.
Thou shalt not lie. I'm sure I read that somewhere before.
Correct. and it's really true. We have your lab data. We have your numbers, and if you produce your glucometer, it's not that hard to figure out. So just be honest, because that's the only way we can treat you. But knowing information, we check a value called a hemoglobin A1C. Hemoglobin A1C gives us an average of what your sugars have been over the last 3 months. It gives us an idea of your overall diabetes status. The problem is it's an average. So if you have lots and lots of super lows and lots of really highs, it averages out to pretty good for the most part. However, the super lows are really bad for you. The super highs are really bad for you. So we want to narrow down that range so that your blood sugars are in a very tightly controlled arena. With blood sugar testing, that's throughout the day, a point here, a point there, we might be missing the highs, we might be missing the lows, and so we never know. I've had patients who go from 30 to 500 all in a day. Normal's about 70 and 80. Diabetics, we want you around 100, 120. And so they average out great, but they're definitely not okay at 30, and they're definitely not okay at 500 or 400. So we want to avoid that. We've had patients where their overall average looked really bad, but their point of care testing looked really good. And we throw on these continuous glucose monitors and we find out why there's, the numbers are not correlating. So technology has really advanced how we treat the patient, and just being able to continuously see what a patient's blood sugar is doing can really help us adjust medication, adjust lifestyle, adjust exercise pattern, adjust eating patterns, so that we can really help patients control diabetes.
Mm-hmm. And you kind of are touching on it, and some of it is a little bit above my head, but if you a little bit more about the technology, the disease monitoring devices that are out there today. I know that you had some examples.
Absolutely. So I think everyone is familiar with the point of care testing that we use, where you poke your finger, you get a little sample of blood, and you put it on a kit, and it tells you what your blood sugar is at that point in time. Now we have these beautiful machines called continuous glucose monitors. And what it is there's a little sensor that goes, oops, that one falling down. This is the one we play with all the time. But there's a little sensor that gets placed right on top of your skin. Depending on the brand, it can be on your abdomen or on your arm. And there's a little tiny filament that is the thickness of about 2 hairs that stays underneath your skin. Now, patients always panic thinking that I'm going to leave a needle underneath their skin, but that does not happen. There is a nice little device that has the sensor already attached to it that contains the needle, where the needle goes in really quickly, leaves the filament behind, and the needle pulls out. So the needle stays here, and you toss this device. And so underneath your skin, there's a little tiny filament that continuously checks your blood sugar. And depending on the device, there may or may not be a transmitter that tells your reader or your receiving device what your blood sugar is. Now, your receiving device could be your smartphone as well. And the nice thing with the devices that transmit the blood sugars is if your blood sugar is rapidly going down or rapidly going up or too high or too low, it sends you a warning saying, hey, gotta go check your sugar, so that you whip out your phone or your receiver to see what your blood sugar is at the moment.
Doctor, I'm sorry, in many cases, would this affect the patient in a way that they would be alerted by that system even before they start to physically feel it? Because I know when my dad was going through, you'd always say, okay, I'm getting the shakes, I'm getting like the willies, I know something's coming on. Would this actually kind of subvert that?
Oh, absolutely. We have patients who have very brittle diabetes where they don't feel their blood sugar until they're literally down on the ground, passed out.
Crashing.
These devices are fantastic because it alerts them that their blood sugars are rapidly changing or are low, so that it tells them, hey, you know what, go check your blood sugar, let's do something about it. On the flip side, if you have a kid whose blood sugar is going too high and are getting into the dangerous territory, it alerts the parents so that, hey, you know what, let's go check your blood sugar, let's fix this problem. The nice thing about these devices also is if you use a smartphone, it goes up and it can transmit to parents. So let's say you have a kid who's in school and they have the device on, they have a smartphone on them. This is also transmitting to their parents or their caretakers and even their teachers if you set it up that way, so that it alarms so that someone checks the child so that you don't have any significant issues in the school. It's great for the elderly too, because if the elderly person is at home while their adult children are at work, the kids can call and be like, hey mom, go check your blood sugar. Hey dad, what's your blood, your blood sugar's super high or super low, let's do something about it. And so these devices are amazing for that. Now, there is a different one that has a similar filament that goes in. It's the Abbott device. It is also used here locally, but you do have to manually check your blood sugar. And so it does not have a transmitter device. And so that device you have to check, but it does share the information with whoever you need it to share with. So let's say that's what's covered by your insurance and you have that device, or it's not covered and you just have the device, and your family has it, the app uploaded on the phone, you can look and say, hey, my dad or my child hasn't checked their blood sugar in X number of hours. I'm worried. You can call in and say, hey, you haven't checked your blood sugar. Can you please check it for me now? And so this has really changed the way people treat and take care of their diabetes. I've had parents that say this is the first time in a really long time that they've been able to sleep through the night because they're not worrying about their kid and waking up at 3 a.m. to check their blood sugar just to make sure that they're not having an event while they're sleeping.
Are a lot of your patients using this particular device or this technology?
So unfortunately in Guam, although these devices, and Dr. Espinoza might be able to give you the exact timeline, have been around for many years, in Guam, we've only really had the advantage of using them in the last, I want to say about 3 years. So first was getting it onto the island. That was a struggle, having pharmacies trying to get their distributors to bring it in. The next problem was insurance coverage. And so there were very strict regulations on when it gets covered, especially with Medicare. So that was a population. And for the longest time, all my patients were self-paying. They felt so strongly about being able to check their blood sugars that many of them were paying for the Abbott machine out of their own pockets to check their blood sugar. It really changed the quality of their lives.
Wow.
Thankfully, in the last year or so, we've had the private insurance companies covering the devices. And so we've had more and more usage of the device. It's covered in different ways depending on the insurance. Unfortunately, our Medicaid population still does not have access to this as far as I know. I could be wrong, and public health could correct me on that. But our Medicare populations and some of our locally privately insured patients do have access to this.
Now, if I may, Dr. Espinoza, yeah, because this seems, part of your work and your life's passion is innovation with underserved communities medically. This seems to be maybe a innovation of economics, of public policy and everything like that. So how do you see us maybe taking better advantage of these new innovations?
No, you're absolutely right. So Dr. Alfred is exactly right. So the CGM technology has been around for a little bit, over a decade. But it's part of it has been that adoption curve has not been so much that patients don't want it or that providers don't want to use it. It's been because of the way how healthcare works, that there's been a problem of physically, as Dr. Alfred said, physically getting it on the island, making sure that it's actually stocked by pharmacies, by various healthcare organizations. And the second is then convincing insurance companies that in fact that they should be paying for this, that it's a covered benefit. And that has lagged behind. When we think about, for example, in children, children are usually covered not by Medicare, but by Medicaid. A funny thing happens where a lot of places, so for example, in the state of California, where I am, most insurances, including Medicaid, will pay for continuous glucose monitors in children, and then they become adults and they switch the type of insurance they have and they lose their coverage for their continuous glucose monitors, which is crazy because you had somebody who was very successfully being managed with this technology. They knew exactly when they were going up and they were going down, and then they lose access to this technology. That's really, again, that really is an equity problem that we need to solve in a society issue, because there's no reason that when a relatively inexpensive technology exists that can really improve outcomes, improve quality of life, why are we setting up barriers that make it hard for people to have access to that? So thankfully, as Dr. Alfred alluded, I think many of the private insurers, the commercial insurance companies on Guam are now covering VCGM. And so slowly patients are starting to be brought onto these platforms and using these technologies. And I think we'd love to work with Medicaid and sort of in public health to make sure that they're able to do that too. one of the things that we hope to be able to accomplish with doing our validation study here on Guam is also to have it be sort of a proving ground that yes, in fact, this technology does improve outcomes for patients living with diabetes. And that should be all you need to make a decision that yes, we should cover these devices and we should provide them to patients because it really generally makes a difference.
Sure.
And I think that that's the direction where people are going, but unfortunately, where healthcare is a slow-moving beast, and so it's we're all taking little steps and we're making progress. And the good thing is, I think that everyone is aligned and realizing that there's a problem, there's a potential solution. How do we get that solution into the hands of the people?
Especially Dr. Alfred, given that diabetes, and I would say you're one of the foremost voices in Guam's medical community about how prevalent this disease is in our island community. I mean, you see it every day. Undoubtedly, people, you're related to people here who have diabetes, people that care for diabetics and everything. So, without trying to get into much of the political side of it and everything like that, how do we basically take this supporting argument that says there is a absolute demand for this and there is like a solution? How can we implement this to the better treatment of our people?
It's been an uphill battle. When I first came to Guam 10 years ago, one of the private insurance companies were only covering the blood sugar testing kit at 50%. This is the glucometers and the test strips. Just so you have a good idea, that means the patient's copay was somewhere between $70 and $80 a month if they were to check their blood sugar 3 times a day. This was unaffordable and remains unaffordable for many of my patients. And this is just a little old-fashioned kit where you poke your finger and check your blood sugars. It took a very long argument with that particular insurance company to acknowledge that it really wasn't considered covered at only 50%. And it was only a specific brand that was rather expensive. And so it's really just advocating for the patients. I was finally able to convince them that they needed to cover a heck of a lot more than 50% to make it affordable for the patients. Thankfully, after enough harassment, they agreed to it. And, it also, again, with the Abbott machine, they're not that expensive, and the equivalent of checking your blood sugars with a nicer blood sugar testing kit, 3 to 4 times a day, the cost is about the same. And so it's been a 3-year argument for this to get covered, and now it's finally getting covered. Thankfully, with one of the insurances, their chief medical officer came up to me, asked me what the deal was. I explained it to them, and they were kind enough to expand the coverage, not just to insulin requiring patients, but to patients on even oral medications, as long as they take part in their diabetes wellness programs. And so I think the insurances are getting a little more open-minded about it. It's definitely a cost versus benefit ratio. And we always have to remember that diabetes is a long-term disease that can cause a lot of complications if not managed properly. And so nipping it in the bud early and getting really good glucose control and getting very good lifestyle changes at the beginning prevents all the costs in the future. It may cost you more in the beginning to be checking your blood sugars more, but in the long term, checking your blood sugars sure as heck is a lot cheaper than having a quadruple bypass that you have to be flown out to California for. So if you look at the grand scheme of things, checking your blood sugar is a cheap and effective way of controlling a long-term complex disease process and preventing changes to the person's body that leads to both poor quality of life if not treated properly, and all these really expensive treatments that may be needed in the future.
Absolutely.
Yeah, I think I really like that answer, Dr. Alfred. And I think what you touched upon is this issue that I think one thing that we don't do well in healthcare is plan for long-term chronic diseases, right? Because chronic diseases don't fit our traditional business models. I'm using business model here loosely because I think it's true of both sort of public insurances like Medicaid and Medicare, and it's true of private insurances, commercial insurances. That we think about money that we collected now, whether that's taxes or insurance premiums, and we think about money that we have to pay now, benefits. But for diseases like diabetes, where it's, yes, you can spend the money today, but you're going to reap the benefit in 5 years, or 10 years, or 15 years. And the benefit is that patient will not need a kidney transplant or will not need a quadruple bypass. And so we don't have a great way to capture the value of that financially. That makes sense to the payers, again, whether it's government or private insurers. So, one of the things that we would benefit from as a healthcare system is better aligning the incentives, right? Healthy people means that overall healthcare costs less. And so if we can somehow make that make sense and have a benefit to everyone now, then I think that's the right direction for us to go. And diabetes is a perfect case study for that, right? These devices, when we say that they're inexpensive, they're a couple $100, right? But it's a couple $100 compared to these test kits that are $70, $80 that Dr. Alford was saying that our patients are paying for. Like, again, it's not exactly a huge markup, but the difference that it makes for individual patients today.
Well, I really like what I'm hearing, because it seems like maybe the overall summary is, things aren't perfect or aren't optimal right now, but they're getting a lot better, and there is progress, and certainly AI health is here, and you got a lot of really, really smart, dedicated, committed people that genuinely care and everything like that, and they've got Guam's back. I don't think that cannot be disputed at all.
Can I just say, when I first came home to Guam, people were still drawing up insulin in a vial and using a syringe to inject themselves. No one had thought to even ask the pharmacies to bring in the insulin pens. I was just blown away. I had never seen a person using a vial and syringe at home. At the hospital, yes, but definitely not at home. So it just blew me away that people were still pulling it up with a syringe. And so I walked over to the pharmacy and I said, why don't we have insulin pens on Guam? And the answer was, well, no one's asked for it. So as soon as I had them order, everyone else is now, it's very rare for me to see someone who's on a vial and syringe. And these are usually people who've been on insulin for over 10 years and are elderly and just don't want to make that change. But now it's almost, I hardly ever see people using a vial and syringe anymore. Well, certain insurances won't pay for the pen, but the private insurances definitely, and Medicare patients are definitely on insulin pens, which is so much easier to use, so much more accurate, and just improves your quality of life, not having to lug that around.
Well, it's like, how does innovation begin? By asking the right question. And I guess.
Absolutely.
Yeah. All right. Well, we got to wrap up and everything. Bree, maybe some final thoughts?
No, I just wanted to thank you first, Dr. Espinosa and Dr. Alford, for joining us today. I know we're going to be talking with you a little bit later in the week. Thank you so much for your time. Joining us tomorrow will be Dr. David Klonoff. He's known as the founding father of diabetes technology. He's also an advisor for AI Health. Also joining us in the Zoom room tomorrow will be Dr. Francisco Pascual. He'll be joining us from Atlanta, Georgia. He also is an AI health advisor. He's been focused on the future of diabetes technology in the hospital and how to accelerate its usability and adoption. And of course, as we've mentioned and you've seen, what we talked about on the link, this Friday, everything will culminate in a virtual town hall meeting, and you definitely do not want to miss that.
All right, so Dr. Erica Alford and Dr. Juan Espinosa, thank you so much for your insight and for sharing the passion that you both clearly have for making sure that we're well here. We do sincerely appreciate it.
Yeah, no, it's our pleasure. And we just appreciate how much work that you guys are doing to help raise awareness about diabetes and opportunities to support the community here in Guam. So thank you for the part that you're playing.
All right.
Thank you.
All right, Dr.
Thank
Alford.
you so much. It's always a pleasure. Thank you.
All right,
We'll
thank
see
you so
guys.
much.
Stay tuned. The link continues after the break.
A Healthier You, Making Diabetes History on Guam.
Presented in partnership with Calvo Select Care and Paradise Fitness Center. Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
Mariana's Irrigation and Landscape Superstore. Stop on by and visit our showroom today. We offer everyday low prices on all major outdoor power equipment like bush cutter, chainsaw, power washer, generators, and more. Need service, repair, maintenance? Well, check out Guam's best superstore only at Mariana's Irrigation and Landscape, located in Barragata along Army Drive between Submarina and Besta Market. Call 735-7446 for more information. Now shipping to surrounding islands. Mariana's Irrigation and Landscape Superstore.
Do you feel like you're missing out on something? Make life more rewarding with Pacific Points. Earn and redeem points for bill rebates and free load at IT&E, discounts on fuel at Shell, vouchers at Foodies, and United Mileage Plus miles. You can even pay with Pacific Points at IT&E, Shell, and Foodies. Pacific Points. Do more, get more.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
This holiday season, we're once again bringing together the island's largest array of local vendors for a special innovative way for you to shop, broadcast, and go digital with Team KUAM. Join us on Sunday, November 28th for the annual Christmas Pops Virtual Holiday Market at 12 noon on KUAM TV8 and the KUAM News Facebook page, plus additional show times through December 11th. We'll also be featuring vendors daily with posts with QR codes and links on our social media pages beginning Monday, November 29th, and hosting an exclusive Christmas Pops website for your one-stop shopping. It's a safe and convenient way for you to shop local this holiday season. To reserve your spot, email promotion.
Join KUAM every Wednesday on Primetime for Inside Business. It's our new weekly segment featuring the struggle of Guam's businesses during this global pandemic. We'll hear from industry leaders about the difficult decisions they were forced to make to implement cutoffs, layoffs, and shorten hours just to survive. It's the other side effect of COVID, the island's economic crisis. We'll also feature new businesses that managed to open and thrive during these challenging times. It's Inside Business every Wednesday on KUAM News Primetime.
Take in the panoramic beauty of our island each Sunday on the KUAM News Instagram with Scenic Sundays. Scroll through the natural beauty of the island on display. Scenic Sundays on the KUAM News Instagram is brought to you by Addis Trust and Investment, Location, Service, Trust, and Häagen-Dazs Shops Guam, where every day is made extraordinary.
We know you're tired of hearing about COVID-19. Some of you are probably wondering whether this is ever going to end. However long it takes, we all have to do our part, including our children, to hold the line. You can protect yourself and your family by getting vaccinated.
And if you're already vaccinated, don't let your guard down because you can still give and get COVID-19. And if you're not vaccinated, remember that if you catch the virus, you could suffer more severe complications. At the end of the day, it's the choices we make to protect ourselves, our families, and our community that will control the spread.
We know it sounds repetitive at this point, but again, wash your hands, watch your distance, and wear your mask.
Together, we have to hold the line.
The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage. With generations of Filipinos calling Guam home, KUAM presents a monthly look at the capital city, featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by KFC.
We all know that a healthy lifestyle is important to prevent chronic diseases and long-term illnesses and boost mental health. It's difficult to determine exactly which healthy habits are worth investing in to live longer and healthier lives. But FHP is here to help. Tune into the link every Tuesday for FHP Hafa Health Tips, brought to you by Take Care. Helpful advice about healthy lifestyle choices that will have a big difference in your health from the medical experts at FHP Clinic. FHP Hafa Health Tips on the link every Tuesday is brought to you by Take Care.
Uno Mixed. We're mixing it up on the last Thursday of every month with a look at lifestyle, entertainment, food, and so much more on the stations, networks, and digital platforms of KUAM Communications. Uno Mixed is presented to you by Docomo Pacific, Better Together, and Pepsi. That's what I like.
KUAM's multi-platform morning show, The Link, just got a little more delicious with Feed Me Fridays. Chris, Sabrina, Jason, and the rest of the morning crew will take some time off each Friday to talk, taste, and tempt you with all the latest and greatest food and drinks on Guam. Old faves, new hits, and everything else we can put in our bellies. It's Feed Me Fridays on The Link. Brought to you by King's Restaurants, Ruby Tuesday Guam, and Devondale. Real milk from free grazing cows. This season, KUAM Communications is ready to go with more games, more championships, and more sports specials guaranteed to bring out the fan in you. Don't miss a minute of gameplay from NBC on KUAM TV 8 or from CBS on KUAM TV 11. We're bringing you all the action and excitement brought to you locally by Marianas Irrigation and Landscape and Docomo Pacific. Catch SportsLink on the KUAM News Morning Show, The Link, every Friday for the latest sports news, game schedules, athlete profiles, and more. SportsLink airs every Friday across the multi-platforms of KUAM. Tune in to the broadcast on Breeze 93.9 FM, on KUAM TV 11, live stream through the KUAM News Facebook page, or view highlights on YouTube, KUAM News Facebook, and Instagram page. SportsLink is brought to you by Marianas Irrigation and Landscape.
Take care. Our island, your health plan.
Stay connected through The Link. Each morning on Breeze 93.9 FM.
It's a long winter night. I sit by the fire all alone.
All right, welcome back to The Link, everybody. Very, very worthwhile information on the previous segment, of course, our week-long look at diabetes, its impact on our community, and some of the technologies and techniques that are innovating the treatment of the disease. We're going to move on right now to our own Tomas Manglonia, who is not in our vicinity today. He is back in the Marianas doing one of his awesome reports. So Tomas is on site right now. Tomas, exactly where are you in the NMI right now?
Hotel, which is one of the quarantine facilities. And as you know, as we reported yesterday, on Friday, new protocols kick into place. So quarantine for fully vaccinated people living with other fully vaccinated people will no longer be required. So.
All right. So you caught the red eye flight basically from Guam to Saipan up there. So on assignment. But you know what? One of the things that you're actually working on is a series, and as I understand it, it's you're titling it 6 feet apart or 6 feet under, right? That's kind of playing on that whole slogan that Governor Ralph Torres had, like when the pandemic first started, about the residents of the NMI and how serious he wanted them to take this. And how are you framing that within the context of your series?
Yes, and so the series launches next Monday. It's 5 parts, and you're right. It's something that many political leaders and community organizers have said. Obviously, throughout this entire pandemic, we've been told to stay 6 feet apart from each other, and obviously, folks saying 6 feet under, being that this virus is, as we've known, proven to be deadly. And so, in this series, we really delve into COVID-19 death and grief. We talk with 5 different people who talk about it from their perspective, whether that's at a funeral home, a morgue, a church, a counselor, or even someone who lost their father early on in the pandemic when, as Chris, as you all know, as the show started at the very beginning, we were told we weren't supposed to be doing certain things when this virus first came out and people started having people in their lives die to this virus almost 2 years ago. And so I think one thing yesterday that came up in one of our last interviews as we're preparing to premiere it next Monday, someone said COVID-19, as we continue to deal with COVID-19, there continues to be the aftermath of anxiety, depression, and grief. And that really sat with me because I guess in some ways similar to COVID-19, in which you can't see it, the grief and the anxiety and the depression that many of us are still going through, and something that we write about every day, we can't become desensitized to the COVID-19 reports, to the Joint Information Center putting out the numbers, right? In many ways, we spoke with the daughter of the 82nd COVID-19 related fatality on Guam, and she explained to us how hard it was not to be by her father's side throughout that entire process. We also spoke with a priest who saw one of the first cremations happen when the guidance at the time was to, quote unquote, cremate the body or treat that death in a different way than a non-COVID death. Mm-hmm. And so lots there to unpack, and we're taking an entire week to unpack that. And we end the series talking about how to deal with the aftermath of this continuing pandemic, the battles that we all have to now prepare for in terms of supporting each other and getting out to the other side, hopefully. So that 6 feet apart, 6 feet under series
All right, really looking forward to that, Tomas. And even though, like across cultures, the grieving process, has a lot of parallels, but at the same time, has some differences. We've actually got our friend Kate Baltasar Dodge in the KUAM News Zoom room right now, so I'd like to, kind of pose this question to the both of you. Good morning, Kate. Half a day.
Half a day. Good morning, and Tomas, half a day, and Tiro, to everybody there, to our brothers and sisters to the north.
So Kate, of course, has this wonderful podcast dealing specifically with grief, and Kate, you have actually emphasized the process that one goes through, and and that even though we all kind of deal with grief in very personal and very unique ways, there is a general model that each of us follow as emotional people and everything like that. So kind of hearing like how Tomas's, the interviews he's done and the reactions he's gotten and the stories that have been shared with him and everything like that. Would you offer maybe any words of wisdom from your own professional training about how, people might be dealing with this?
Certainly. And I have to commend Tomas for taking on such a huge task of unpacking and kind of getting to all the moving parts about grief. Grief in general, is really uncomfortable, even for a community and culture like ours that is very close-knit and very family-oriented. Grief is one of those topics that it just doesn't sit well, to talk about and to discuss, in many circles. So, Tomas, you're doing amazing work there. One of the things that Tomas hit on the head is that, these practices that are new, that have to do with how we grieve in general, which was already kind of like, if you go to my podcast and you listen to episodes 1 and 2, everything that we're doing that the pandemic has mandated us to do is so contrary, right, to the way that we support and love on each other in good times and bad times. And so when you are talking about the loss of a loved one and grieving, and then also not being able to grieve in the cultural, and do the customs and things that, we're able to do to bring each other comfort in a time of sorrow, it kind of amplifies that. And then you're talking about grief over the holidays. And so when we're talking about grief over the holidays are the most wonderful time of the year, but not for everyone. This is not, and we have to be sensitive to that. Episode 3 just dropped and talked about short-term energy relieving behaviors. These are the behaviors that we employ to mask our grief and to self-medicate, to kind of sort of get through these feelings of grief and loss that can also be very, very destructive. What are we talking about? Alcohol, drugs, overeating, overworking, even overworking out, working out too much, gaming, streaming Netflix, and just on end. So these are the kind of things that I delve into a little bit in episode 3. Episode 4 talks about grief over the holidays, right? And that's part 1. So the part 2 will be episode 5. But in episode 4, it talks about how do we move about in our spaces in something as simple as a greeting card, sending a greeting card to somebody who's grieving, right? We don't think about it. We think we're being absolutely thoughtful, and we are, but there are just some things you might want to consider, in how you message that greeting card or that gift to the person who's grieving, especially if it's a recent loss. So there are all these things. We had huge upticks in calls, and I also, I always have to put a plug in for my advanced grief recovery specialist colleague, Darlene Garcia. We would do these community talks, and that was one of the things that we were seeing a lot was I could only have 10 people at this funeral. That has changed a lot now, but at the time, it was just like, what do you mean I can't have everybody there? What do you mean I can't serve food? I can't even feed, the mourners that come, to pay their respects. There, you know, there's just so many things. I was talking to Senator Tony Atta about it because, you know, he was in the business at the time before he got back into the legislature, still running their family business. And I would see it, you know, just so profoundly how much it affected us when we're not able to grieve in the ways that we're used to, the ways that were passed down to us, you know, through the generations, on how to care for each other,
Sure.
you know, while we mourn.
Well, we do want to play a episode from episode 3 right now, Kate, which is right now available on the KUM Podcast Network. This is Kate Baltazar Dodge's latest discussion of how you can deal with and overcome grief. Here's a sneak peek at episode 3.
We often talk about when we were doing our group grief talks in the community, we would talk about not just the myths of be strong, replace the loss, time heals all wounds. You know, those are kind of like the things that people say to you. And you might have said to people who are grieving, that again are misinformed, well-intentioned, right? Because people think they're making you feel better by saying don't feel bad and replace the loss somehow to try to get you to grieve faster, to hurry up with your grief, because it's uncomfortable for us, and also we don't like seeing you sad. And so grief knows no timeline. I don't know if I had touched on that, but we go through so many grief events in our lives, and we don't realize them until we're older, that we look back and we're like, oh, that was I don't know why this is touching a nerve with me now. And sometimes an event will happen and it will open up a whole other host of other feelings and memories of grief events that you had as a child, or as a young adult even. And now you're sort of reliving this grief and you're wondering, gosh, that happened so long ago. Why am I feeling so badly about it now? Grief knows no timeline. You know, that event is a part of you, and it's a part of your emotional history.
One with Grief, episode 3, now available on the KUM Podcast Network. We're also going to share the full episode later on this afternoon, so you can listen to it at lunchtime. Really, really good stuff from Kate. And Tomas, I'd say, you know, I know you're doing a 5-part series, but if you ever want to make like a little bonus episode, I think with Miss Kate, you've got a perfect candidate with someone with a very, very deep knowledge in this kind of thing, and certainly the type of information that a lot of people can benefit from.
Yes,
I would be honored. I would be honored. Yeah.
Yeah, and as I learned, right, the healing process never ends. So, Kate, whenever you want to have that conversation, always open to it too.
Yeah.
Perfect, Tomas.
All right. Well, thank you guys. We're glad this little matchup worked out, and we're looking forward to your series, Tomas, your new episode, Kate, and anything you guys might work on together in the future. Thank you, guys.
Perfect. Thanks, Chris, Jay, Bree, and Tomas. Have a wonderful day.
You too, Kate.
And Tomas, make sure to let us know what they're feeding you over there. Huh?
I will tomorrow. Stay
Tomorrow,
tuned.
right? That's right. Yeah, take a lot of pictures, get receipts. Jay, where can they find the new episode of One with Grief and other great content on the KUM Podcast Network?
You can go to our website at KUM.com and just go up at the top where it says listen, and then put your mouse over that and then choose podcast. Or if you just want to go in your favorite podcast client and go in Apple Podcasts, on Spotify, Amazon Music, Audible, Player.fm, all you got to do is search for One with Grief, and you're going to find Kate's show, and it's very, very, very good stuff.
Right. Hey, it's 9:58, guys. We're gonna leave you with Burger King's "Cover Me." Okay, this is an awesome segment. They support the local music, reminding you, I know you like it hot. You like it pika, right? You like a little bit of that burn, don't you?
You're so spicy, Chris.
I know. It's the ghost pepper chicken nuggets at Burger King. Go get hot, all right? With our friends at Burger King. Also, Docomum Civic, proud to present Cover Me. For Sabrina, Jason Joser, Mike V, it's been a great episode of The Link. Thank you guys on KUM TV for jamming with us. My name is Chris. Hasta. Adios.
I don't know. All this fake take love ever since I got to where I am today. It's just too much for me to handle, you know what I'm saying? It's just, what if I never got to where I am today? Would these same people still be around me? A lot of people know me as Claude, but don't know me as Claude, you know what I'm saying? Oh yeah, oh yeah.
Tell me, would you stick around if I was no one? I won't lie, sometimes I overthink, and it gets the best of me, but I know I'm not the only one. Tell me, would you stick around if I was no one? I won't lie, sometimes I overthink, and it gets the best of me, but I know I'm not the only one. Lately I've been trying to decide if I should keep on going or just put this to the side. Cause I don't even lie, losing my mind, trying to get by, all my demons laughing high like, what's the joke? I don't know. So many people be trying to get in my head, but they never get close. One day who knows, soon I'ma blow, then I'ma know. All the ones that hate it gon' be in the front row. Tell me, would you stick around if I was no one? I won't lie, sometimes I overthink, and it gets the best of me, but I know I'm not the only one.